We begin in the medical wards of early 20th century Europe, when cocaine was not a street drug but a licensed stimulant, a clean, white powder trusted by surgeons, chemists, and military physicians. By the time the Third Reich emerged, that trust had already hardened into policy. German doctors believed the substance sharpened focus, suppressed fear, and kept exhausted men awake long after the body should have collapsed. Inside the laboratories of the Reich, the drug was tested not on criminals or volunteers, but on soldiers preparing for a war they were told would be lightning fast and absolute. Field reports described units marching for days without rest, pilots flying mission after mission with alertness that bordered on mechanical. The official explanation was discipline. The hidden truth was chemical. This was the moment when medicine and militarism fused, when a nation, under dictatorship, pushed human endurance past the edge of reason. Behind the propaganda rallies and the spotless uniforms, another story ran quietly through the veins of the army. A story of a drug once praised as harmless, and how it became one of Nazi Germany's darkest secrets. So tonight, turn down the lights and settle in. Imagine the quiet hum of a field hospital, the trembling hands of a medic, and the unseen chemicals shaping decisions on the front line. Subscribe and stay with me. Tell me where you're watching from as we uncover the hidden machinery behind a war that rewrote human limits. The story begins long before the rise of the Third Reich. In an era when European medicine was racing toward modernity, the late 19th and early 20th centuries saw laboratories across Germany filled with glass jars, copper, instruments, and the sharp smell of antiseptic, a world where discovery felt limitless and every new chemical seemed like a step toward progress. It was here, inside teaching hospitals and university clinics, that a clean, white powder first gained a reputation that would echo far beyond its intended purpose. Cocaine entered German medical circles as a breakthrough. It was extracted, refined, and catalogued with the same precision used for any other pharmaceutical. Surgeons noted how it numbed tissue. Psychiatrists observed how it heightened alertness. Military physicians, even then, quietly recorded how it sharpened attention during long nights. There was no stigma, no shadow of illegality, only the sense that science had uncovered something useful, efficient, and modern. Doctors across Europe embraced it quickly, but in Germany, enthusiasm grew faster than caution. Research journals described a stimulant that could keep patients awake, reduce fatigue, and dull certain forms of pain. Chemists in Berlin and Hamburg refined its purity, filling small glass vials with crystalline powder that glowed faintly under lamplight. These vials were stocked on shelves, beside morphine and aspirin, treated with trust rather than suspicion. What no one fully understood or wished to understand were the early signs of dependence. Case notes mentioned patients returning with trembling hands. A surgeon documented one colleague who seemed unable to stop testing small doses on himself. A few military doctors admitted privately that soldiers on long marches seemed unusually euphoric before collapsing days later. These warnings remained in the margins, quiet observations drowned out by the louder optimism of the age. Germany, after all, was a nation rebuilding its confidence. Industrial growth surged. Universities stood at the forefront of research. In this environment, a drug that promised stamina and precision fit perfectly into the national narrative. It was not seen as a threat, only as another tool in the expanding arsenal of modern medicine. By the early 1930s, the political landscape had changed, but the drug's reputation had not. When Adolf Hitler came to power, promising restoration, discipline, and national strength, the medical system he inherited already considered cocaine a legitimate stimulant. It was not yet associated with nightlife or criminality. It was not seen as dangerous. It was simply part of the medical toolkit, a refined chemical produced by reputable companies, used by respectable doctors. This foundation mattered when the new regime began exploring ways to push soldiers beyond human limits, They didn't have to invent a substance or search for an experimental compound. The drug was already waiting on pharmacy shelves, its dangers underestimated, its potential misunderstood. To the Reich's medical planners, it seemed less like a risk and more like an opportunity. And so, a story that began in bright laboratories and quiet clinics would soon move into fields, trenches, bunkers, and cockpits. The miracle powder of early 20th century medicine was about to become something else, a tool of war, endurance, and control. In the beginning, it was simply a white powder. What it would become was far darker. Long before the world understood the dangers of stimulants, German operating rooms became the proving ground for cocaine's reputation. Hospitals in Munich, Leipzig, and Berlin were filled with the sounds of clattering metal trays, the steady pulse of gas lamps, and the low murmur of surgeons, discussing techniques that would reshape modern medicine. In these sterilized halls, where precision meant life or death, the white powder earned a place of authority. Surgeons valued anything that increased steadiness, focus, and stamina, especially during procedures that stretched into the early hours of morning. Before the arrival of advanced anesthetics, operations were battles against time, blood loss, and fatigue. Under these conditions, even a slight improvement in alertness felt like a breakthrough. Cocaine, with its ability to heighten concentration and delay exhaustion, was quickly integrated into surgical routines. It was administered in controlled doses, logged in neat cursive handwriting on patient charts, and discussed at medical conferences as a practical tool with clear, measurable benefits. Its use was not reckless, at least not in intention. German medicine, renowned for rigorous standards, treated the drug with the same methodical care as any other innovation. Surgeons monitored pulse rates, studied reflex responses, and published papers detailing its effects on both patient and practitioner. At first, there were no dramatic incidents, no public scandals. Instead, there was quiet confidence, a belief that they had discovered something that could make their work more exact, their movements more stable, their success rates higher. But beneath the controlled environment of the operating room, subtle changes began to appear. Surgeons who had once taken occasional doses to steady their hands during long procedures found themselves relying on the drug even during shorter ones. Assistants noted that certain senior doctors stayed unusually alert late into the night, performing operations with a mechanical precision that unnerved younger trainees. Some physicians described a clarity that bordered on euphoria, a sense that the drug sharpened not just focus but ambition. The medical journals of the era captured the tension without fully acknowledging it. One report praised the drug's ability to sustain mental acuity during prolonged surgical engagement. Another hinted at complications, mentioning restlessness and persistent wakefulness in practitioners who had used it regularly. But the warnings were faint, overshadowed by the prestige of German medical institutions and the broader cultural faith in scientific progress. Outside the hospitals, the pharmaceutical industry took notice. Manufacturers quickly realized there was growing demand among doctors, and production quietly expanded. New formulations appeared: tablets, injectable solutions, standardized doses designed for ease of use. Every advancement made the drug more accessible, more routine, and more embedded in everyday medical practice. By the early 1930s, as the political climate darkened and Germany drifted toward authoritarian rule, cocaine had already become a hidden pillar of the medical costing world. It was accepted, trusted, and largely unquestioned. This acceptance would shape the decisions of military physicians who later sought to enhance soldier endurance. After all, if surgeons, the most precise and disciplined practitioners of medicine, relied on the drug to push through fatigue, why couldn't the infantry, the pilots, or the tank crews do the same? The operating rooms of pre-war Germany did more than refine surgical technique. They laid the groundwork for a dangerous assumption that chemistry could perfect human performance without consequence. It was a belief that would soon move beyond hospitals and into the machinery of war, where the cost of that assumption would be measured not in academic reports, but in lives, judgment, and the unraveling of human limits. And in that shift, the white powder used to steady a surgeon's hand would become a quiet, potent weapon, one far more influential than anyone in those early hospital wards ever imagined. In the years before the Third Reich, Germany stood at the center of European medical science. Its universities formed a network of research powerhouses: Heidelberg, Göttingen, Freiburg, Munich, each staffed by specialists who treated laboratory work with almost military discipline. Within these polished lecture halls and meticulously organized clinics, cocaine was not an illicit substance. It was a legitimate pharmaceutical, catalogued, quantified, and studied under the controlled confidence of a nation that believed its medical establishment was among the most advanced in the world. Medical students learned to handle the drug as part of their training. Professors demonstrated its anesthetic properties, carefully applying it during minor procedures or illustrating its effects on peripheral nerves. Pharmacology classes emphasized its unique ability to sharpen mental clarity. There were charts, diagrams, and lectures explaining dosage rates, metabolic breakdown, and the physiological mechanisms behind its stimulatory effects. Everything about the approach was clinical, methodical, and orderly. This institutional trust shaped the attitudes of an entire generation of physicians. To them, cocaine was simply another tool, not unlike digitalis or morphine, potent, yes, but manageable under professional supervision. The medical journals reinforced this view. Articles published in respected German periodicals highlighted successful treatments, improved surgical outcomes, and enhanced patient recovery times, while a few researchers cautiously noted unusual behavioral changes in certain patients. These concerns rarely reached wider audiences. They were treated as anomalies, not warnings. Funding played its part as well. German pharmaceutical companies, already producing a wide range of stimulants and anesthetics, supplied universities with free samples for testing. Industrial chemists refined the powder to higher purities, distributing it in clearly labeled glass vials with precise measurements. This collaboration between academia and industry created a pipeline of innovation, one that encouraged experimentation, rewarded new applications, and minimized hesitation. In this environment, a substance with the potential for dependency was easily treated as harmless when administered under professional oversight. But the medical establishment operated within a bubble, walled off from the social realities beyond its institutions. While clinic directors debated theoretical risks in journals, addiction cases slowly appeared in working-class neighborhoods. A handful of general practitioners documented patients who returned repeatedly for fatigue treatments. Pharmacists quietly noticed customers whose prescriptions for stimulant powders grew more frequent over time. Yet, without unified reporting or serious public discussion, these isolated incidents seemed insignificant symptoms of individual weakness rather than evidence of systemic danger. By the late 1920s, a new generation of ambitious researchers entered the field. They saw Germany's medical reputation as a foundation they were destined to expand. To them, caution was often interpreted as stagnation. They pushed boundaries, experimented with combinations of stimulants, and sought ways to maximize human efficiency, an idea increasingly echoed by the political climate emerging across the nation. When the National Socialists rose to power, they inherited a medical system steeped in confidence, accustomed to experimentation, and largely uncritical of pharmaceutical overreach. The state did not need to convince university researchers to explore ways to improve endurance or suppress fear. Many were already investigating such possibilities long before militarization became explicit policy. In this way, the groundwork for misuse was laid not through malpractice or corruption, but through institutional momentum, the quiet belief that science, if applied rigorously, could solve almost anything. What the medical establishment failed to see was that their careful academic detachment could be redirected with ease. A tool once studied in lecture halls could just as easily be issued across barracks, airfields, and armored divisions. In the pristine laboratories of Germany's medical institutions, the white powder remained a scientific asset. But outside those walls, a different future, for the drug was already forming one shaped not by academic curiosity, but by the demands of a regime preparing for war. By the time the 1930s approached, cocaine had completed its quiet journey from the universities to the civilian world. What began as a laboratory compound, studied by professors and used sparingly by surgeons, gradually became a fixture of German pharmacies, small, discreet, and respectable. Behind polished wooden counters and glass display cases, chemists stocked neatly labelled vials containing the crystalline powder, treating it with the same ordinary professionalism given to cough syrups, tonics, and sedatives. Pharmacies in Berlin's inner districts, in the factory, towns along the Ruhr, and even in rural villages carried the substance without hesitation. Customers arrived with prescriptions written in the tidy handwriting of their physicians, and pharmacists, trained with an almost military precision in measurement and dosage, filled them without question. There were no warning signs, no restrictions, no stigma attached to the drug. It was, quite simply, another product of modern science in a country that prided itself on intellectual and industrial excellence. German chemical companies, some of the largest and most sophisticated in Europe, recognized the profitability early. They refined production lines, adjusted formulations, and created standardized packaging. Their catalogues advertised cocaine as a reliable stimulant for exhaustion, melancholy, and nervous weakness. It was promoted as a solution for overworked clerks, sleepless mothers, and factory workers who labored through long shifts. The marketing language was careful, scientific, and understated, emphasizing reliability without dwelling on risks. The pharmacists themselves trusted the system because the system had always rewarded trust. German medical regulations were strict but predictable. If a substance made it into legitimate pharmaceutical circulation, it was assumed safe when handled correctly. And for a while, this assumption held. Most customers used the drug in small quantities, never suspecting its addictive potential. The few who did return repeatedly, asking for refills earlier than expected, were dismissed as unusual cases. The profession lacked a unified mechanism to identify patterns or raise alarms. Meanwhile, the lines between medical supply and civilian consumption blurred further. Pharmacists stocked not only the raw powder, but also tablets, nasal solutions, and combination remedies that mixed cocaine with other stimulants. These items were sold over the counter or prepared on-site in compounding rooms filled with brass scales, funnels, and mortar bowls stained with traces of countless prescriptions. Everything about the process reinforced the illusion of routine safety. It was during this period that the Reich's military planners began paying attention. The presence of a widely accepted stimulant, legal, affordable, and backed by decades of medical use, offered strategic possibilities. If civilians relied on it for endurance and clarity, what might soldiers accomplish with controlled doses? To the Wehrmacht's medical officers, the existence of the drug in pharmacies meant one thing: the infrastructure was already in place. Production could be scaled, distribution networks existed, standards had been established. Yet even as these military considerations took root, the civilian world saw a different, quieter shift. A small but growing number of pharmacists noticed customers becoming increasingly dependent. Some described a slight tremor in their hands. Others spoke of sleepless nights, racing thoughts, or an unshakable sense of alertness that felt less like health and more like compulsion. Still, these warnings rarely left the counters where they were spoken. Without centralized oversight, there was no coordinated response, only isolated concerns that faded into the background noise of a nation undergoing profound political change. By the time the Nazi regime began consolidating its control over every aspect of German society, the path for militarizing stimulants had been smoothed by civilian acceptance. Laboratories had developed the compound, Medical institutions had endorsed it, pharmacies had normalized it, and the public, unknowingly, had helped create a culture where chemical endurance seemed not extraordinary, but simply modern. The white powder had quietly woven itself into daily life. Soon, it would leave the pharmacies behind and enter the barracks, the cockpits, and the front lines. What had once been a medical tool was becoming something else, a resource for a nation steering itself toward war. By the early 1930s, the veneer of safety surrounding cocaine began to crack, not in laboratories or hospitals, but in the quiet corners of ordinary German life. It appeared first in small, unremarkable patterns: a factory worker asking for an early refill, a clerk returning to the same pharmacy with excuses of misplaced vials, a housewife complaining that her nerve powder no longer worked as quickly as before. These cases were scattered and isolated, but together they hinted at a darker truth forming beneath the polished surface of medical confidence. Most of Germany never recognized it as addiction. The word carried heavy judgment, associated with weakness or moral failing rather than chemical dependency. Instead, people spoke of overuse or habit, soft phrases that concealed the severity of the problem. Many of those affected were ordinary citizens with demanding lives. A railway conductor struggling with long shifts used the drug to stay awake. A typist in a government office relied on it to push through deadlines. A mother of three, exhausted from constant childcare and household labor, quietly took small doses to feel steady. Each believed they were simply using a medicine recommended by professionals. Pharmacists were often the first to notice changes. Some customers developed a nervous impatience, tapping fingers on counters as they waited for service. Others exhibited sharp irritability or sudden energy, followed by visible fatigue. A few spoke so quickly that their words blurred, yet insisted they needed another vial, just in case. These signs unsettled experienced chemists, but without a national reporting system, their concerns remained confined to individual shops. Private observations recorded at most in personal notebooks. General practitioners faced similar dilemmas. They encountered patients who returned repeatedly with vague complaints, persistent headaches, racing thoughts, unexplained anxiety, or sudden emotional crashes. A handful of doctors suspected dependency, but with no formal guidance from medical boards and no public campaign warning of risks, their suspicions rarely led to action. Some prescribed alternative remedies. Others simply adjusted dosages. A few, overwhelmed by the volume of patients, continued issuing prescriptions without deeper questioning. The problem worsened quietly, compounded by economic pressures. In working-class neighborhoods, the drug's stimulant properties made it a tool for productivity. People took it to endure double shifts, to meet factory quotas, or to handle the physical strain of industrial labor. Employers, knowingly or not, benefited from a workforce chemically pushed beyond normal limits. Still, the issue remained invisible to the national discourse. Newspapers did not publish investigative reports. Politicians did not mention the growing dependency. The pharmaceutical industry, confident in its product and its profits, released no warnings. And the medical establishment, focused on academic research and internal debates, failed to connect the scattered signs into a coherent picture. It was within this context of normalization, where reliance on stimulants was seen as convenience rather than crisis, that the Nazi regime rose to power. When military planners later examined ways to enhance soldier performance, they found a society already accustomed to chemical assistance. The early addiction cases, overlooked by civilian institutions and overshadowed by political upheaval, taught an unintended lesson. Stimulants could be integrated into everyday life without major resistance or regulation. In the end, the civilian world provided a silent rehearsal for what came next. A scattered pattern of dependency, ignored in pharmacies and clinics, foreshadowed the systematic use that would soon shape the endurance of soldiers marching across the fields and forests of Europe. The white powder that had once seemed harmless was proving its power not only to sharpen minds, but to take hold of them. As the 1930s unfolded, the growing unease surrounding stimulants reached the desks of Germany's medical elites. It did not erupt as a public controversy or a political scandal. Instead, it emerged as a series of academic disagreements quietly exchanged in conference halls, journals, and research institutes. The question was simple: how safe was cocaine, truly, when used repeatedly over time? And beneath that question lay another, far more pressing for the nation Germany was becoming. Could its effects be harnessed for strategic advantage? The debate formed along familiar lines. On one side stood traditionalists, senior pharmacologists and physicians who urged caution, citing early case notes of dependency and emotional instability. They pointed to reports from general practitioners who described patients suffering tremors or unpredictable mood swings. A few researchers in psychiatric clinics even warned that the stimulant interfered with natural sleep cycles in ways that could degrade judgment. Their arguments were measured, technical, and grounded in decades of conservative practice. On the other side stood a younger, more ambitious generation. Scientists, shaped by a Germany hungry for renewal after the humiliation of the First World War and the economic collapse that followed it. They believed that modernity demanded boldness. To them, stimulants represented not risk, but possibility. If managed properly, they argued, cocaine could enhance productivity, sharpen focus, and extend human endurance beyond traditional limits. Their presentations often featured charts, metabolic graphs, and optimistic conclusions. They pushed for trials, for innovation, for the idea that chemistry could shape a stronger nation. The debate intensified as Germany's political climate shifted. By 1933, with the rise of the Nazi regime, scientific inquiry became increasingly entangled with ideology. Research that aligned with national goals, strength, discipline, efficiency, received funding and attention. Studies that emphasized restraint or highlighted danger faded into the margins. Whether intentionally or simply through bureaucratic inertia, the balance tilted toward those who viewed stimulants not as a threat, but as an opportunity. Meetings in medical academies reflected this change. Discussions that once focused on long-term effects gradually shifted toward short-term performance gains. Researchers began presenting data on alertness retention, extended wakefulness, and combat concentration, metrics that blended scientific curiosity with military utility. The medical journals of the era reveal this shift in subtle ways. Cautionary articles became rare, while studies praising the drug's effects on stamina grew more frequent. Meanwhile, economic forces added another layer to the debate. Pharmaceutical companies, many of them intertwined with industrial giants who supported the new regime, saw increased production as both profitable and patriotic. They supplied researchers with purified samples, sponsored clinical trials, and expanded manufacturing capacity. Their involvement pressured the medical community toward a more favorable interpretation of the drug's potential. Despite these shifts, the traditionalists did not stop raising concerns. In small, sparsely attended conferences, they spoke about dependency, psychological disturbances, and the ethical implications of widespread stimulant use. Some even warned that reliance on artificial endurance might lead to a dangerous overconfidence, masking physical and mental limits that could not be chemically overridden. But their voices carried little weight in a society where dissent, in any form, was becoming increasingly hazardous professionally and politically. By the eve of the Second World War, the pre-war debate had not ended with resolution. Instead, it had collapsed under the pressure of national ambition. Those advocating caution found their research unfunded, their arguments sidelined, and their influence diminished. Those advocating expanded use found themselves aligned, intentionally or not, with a military machine seeking every advantage it could obtain. What remained was a fragile consensus, shaped not by scientific certainty, but by political momentum. Cocaine, once debated in quiet academic rooms, was now seen as a potential instrument of national strength. The warnings had been recorded, the caution had been spoken, but Germany was moving toward a conflict that would ignore both, choosing instead to lean on chemistry as it prepared to push its soldiers past human limits. The drug had been normalized. Now it would be weaponized. By the mid-1930s, Germany no longer resembled the fractured republic that had struggled through inflation, unemployment, and political infighting. Under Nazi rule, the nation was reshaped with startling speed. Streets resounded with marching boots, factories roared with renewed purpose, and a disciplined atmosphere pressed itself into every layer of civilian life. The transformation was visible. Uniforms, flags, restored infrastructure, but beneath these outward symbols, another form of preparation was underway. The search for biological and chemical means to maximize human endurance. The German High Command studied the lessons of the First World War with a cold, analytical eye. The previous conflict had taught them that modern war was not only a contest of weapons and strategy, but also a battle against exhaustion. Soldiers faltered not merely from enemy fire, but from sleeplessness, hunger, and the grinding psychological toll of continuous combat. Hitler's generals believed that the next war would be faster, more mechanized, and more demanding. They needed an army capable of moving at relentless speed, an army that could march longer, fight harder, and react faster than its adversaries. This mindset spread through the military medical corps. Officers in starched white coats reviewed diaries from trench veterans, medical logs from frontline hospitals, and post-war analyses detailing how fatigue had undermined entire operations. Their conclusion was simple and sobering. Traditional rest cycles and natural endurance would not be enough. If Germany intended to strike quickly and decisively, it required soldiers whose stamina exceeded normal human limits. The search for solutions took many forms. Nutritionists tested high-calorie rations designed to reduce recovery time. Physiologists studied breathing techniques meant to improve oxygen retention. But among the more unconventional ideas was the increasing interest in pharmaceutical substances that could artificially maintain alertness, banish fatigue, and suppress fear. In this climate, cocaine's already established reputation became impossible to ignore. The military observed how the drug had integrated itself into civilian life without major unrest. Factory workers who used stimulants completed longer shifts. Students relying on study powders performed well in demanding academic programs. Even railway staff, postal couriers, and night shift labourers used small doses to endure harsh schedules. To military planners accustomed to thinking in terms of logistics and efficiency, these examples suggested potential applications on a grander scale. At closed-door meetings, senior officers spoke candidly about their ambitions. They envisioned infantry units capable of marching through consecutive nights without sleep, pilots whose reaction times remained sharp across long missions, and tank crews able to maintain concentration inside steel compartments for extended operations. Chemical assistance was not viewed as an ethical question, but as a tactical one. If a substance could create a strategic advantage, the argument went, it warranted serious consideration. Physicians within the Wehrmacht raised concerns, but cautiously. The political atmosphere left a little room for dissent. Those who recommended restraint were urged instead to seek methods of controlled use. Those who highlighted dependency were told the issue could be managed through strict oversight. The regime valued obedience, and science, once a field of debate, was now an instrument of state ambition. Meanwhile, German pharmaceutical companies noted the shifting priorities and adjusted accordingly. They increased output, refined purity levels, and prepared to scale production further if required by the military. Their cooperation was not only profit-driven, but ideologically reinforced. Many saw themselves as contributors to the nation's resurgence. By 1938, the military had begun quietly cataloguing its options. Reports circulated through the medical branches detailing which substances produced the sharpest alertness, the longest, periods of wakefulness and the fewest immediate complications. Cocaine, already trusted and widely available, appeared again and again in these documents, not as a curiosity, but as a potential asset. Germany was preparing for conflict not only with tanks, aircraft, and rifles, but with an expanding willingness to manipulate the human body itself. In the rush toward war, stimulants were no longer seen as a last resort. They were becoming part of the strategy, and soon, the drug that had once sat harmlessly on pharmacy shelves would move into barracks, airfields, and command posts, quietly setting the stage for a new kind of soldier in a new kind of war. Within the expanding German war machine of the late 1930s, no institution felt the pressure of impending conflict more sharply than the Wehrmacht's medical corps. Its officers were expected to solve a contradiction at the heart of modern warfare. Soldiers needed to be stronger, faster, more alert, and more durable than ever before, yet still retain the judgment, discipline, and coordination crucial to coordinated mechanized operations. Natural endurance had its limits. War did not. Inside stark military hospitals and training grounds, physicians and medical researchers confronted this challenge with clinical resolve. They observed infantry recruits collapsing after forced marches, pilots trembling after long hours in flight simulators, and tank crews emerging from drills with glassy eyes and slowed reflexes. Modern military demands were outpacing human biology. The question was not whether to intervene chemically, but how soon, and with what. By this time, cocaine was already familiar to many officers through their civilian training. They had seen it used in surgical wards, psychiatric clinics, and pharmacies. They recognized its ability to stave off fatigue, sharpen attention, and elevate mood. Combined with rising political pressure to produce a fighting force ready for prolonged exertion, this familiarity transformed into professional curiosity. Reports began circulating from military physicians who had quietly tested small doses during training exercises. In one account, a reconnaissance unit completed a 40-kilometer night march with fewer rest breaks than expected. Another described pilots who maintained exceptional clarity during long aerial observation drills. These notes were careful, factual, and cautious, but they caught attention. The medical corps logged these observations in internal bulletins, framing them not as experiments but as performance assessments. Yet the officers also noticed troubling elements. Some soldiers displayed a restless agitation that bordered on aggression. Others experienced a rapid decline once the stimulant effects faded, crashes marked by emotional exhaustion, tremors, or sudden lethargy. A few became irritable, argumentative, or unusually bold in ways that concerned trainers. These symptoms appeared sporadically, often dismissed as individual temperament rather than chemical reaction. Despite these signs, interest continued to grow. The medical corps operated within a hierarchical structure where hesitation was interpreted as inefficiency, and efficiency was synonymous with patriotism. High-ranking officers insisted that any tool which could enhance operational readiness deserved exploration. The subtle warnings buried in field test notes were overshadowed by glowing comments about sustained alertness and reduced need for rest cycles. Pressure mounted when foreign intelligence reports suggested that other nations were exploring similar chemical possibilities. Whether these reports were accurate or exaggerated mattered little. They hardened German resolve. The notion that rivals might develop chemically sustained soldiers turned stimulant research from a curiosity into a national priority. As interest deepened, the medical corps requested more comprehensive studies. They needed data on long-term use, dosage regulation, and the impact on decision-making. But the regime's appetite for rapid results meant these studies were rushed, condensed, or partially ignored. The more troubling findings: dependency, patterns, impaired judgment during crashes, increased impulsivity were mentioned but not emphasized. What mattered most to leadership was the potential for immediate tactical gain. In officers' meetings, the dialogue shifted from academic caution to logistical planning. How much stimulant would a division need for a 3-day advance? How could supply lines integrate pharmaceutical distribution? What protocols should govern use in aviation versus infantry? The Medical Corps, once hesitant, found itself drafting guidelines for substances that had never been formally approved for military use. By the eve of war, the Corps had accepted a new reality. Stimulants were no longer marginal tools but part of Germany's strategic preparation. The ethical questions faded behind administrative ones. Dosages, forms of delivery, storage conditions, and distribution procedures took priority. Science had been absorbed into the machinery of war, and so the officers of the Medical Corps, many trained to heal, stepped into a role that blurred medicine with militarism. They had noticed the drug, studied it, tested it. Now they were preparing to issue it. Soon, the stimulant that had once lived in clinics and pharmacies would become standard equipment in a soldier's kit, carried beside ammunition, rations, and steel. The line between medicine and weapon was beginning to disappear. On the eve of the Second World War, cocaine occupied a strange place in German society, widely used, medically respected, and almost entirely free of social stigma. Unlike alcohol, which carried moral judgments, or opiates, which evoked cautionary tales, cocaine existed in a neutral space. It was a substance without cultural baggage, a chemical defined by clinical efficiency rather than public perception. This absence of reputation made it easier for institutions, including the military, to shape its identity according to their needs. For most Germans, cocaine had never been associated with vice. It did not appear in sensational news stories. It was not the subject of political debates or church warnings. It had entered the civilian world through prescriptions, not black markets, and its legitimacy came from white-coated physicians and polished pharmacies. Even those who used the drug casually, students preparing for exams, night shift workers, clerks with long hours, rarely saw it as anything more than a tool, a modern solution to modern fatigue. This cultural neutrality extended into the information channels that shaped public understanding. Medical journals wrote about the drug in technical terms, discussing dosage, applications, and cautions without moral interpretation. Newspapers reported on scientific developments with admiration, highlighting Germany's role at the forefront of chemical innovation. No major publication warned of widespread dependency. No political faction demanded regulation. Cocaine existed in a quiet, unexamined space, protected by the authority of the medical establishment. Within this environment, pharmacists played an unintended role. Their daily interactions with customers reinforced the perception that cocaine was safe. When used responsibly, they handled the substance with professional calm, measuring doses with brass scales, storing vials in glass front cabinets, and advising clients with the same tone used for cough syrups or vitamin supplements. There was no ritual of secrecy, no whispered caution, no locked cabinets requiring special authorization. The drug blended seamlessly into the routines of everyday healthcare. This lack of scrutiny was not merely cultural, it was structural. Germany's regulatory system, though rigorous in many areas, treated pharmaceuticals with a level of trust that left blind spots. Once a drug passed initial testing and earned a place in medical inventory, oversight diminished. Follow-up studies were sporadic, often conducted by researchers with limited funding and little influence. As the nation moved closer to war, government priorities further shifted away from scrutiny and toward utility. For the military, this context proved advantageous. When Wehrmacht medical officers began exploring stimulant use, they did not have to confront social resistance or institutional hesitation. There were no public fears to alleviate, no political roadblocks to navigate. The drug's neutrality meant it was a blank slate, one that could be repurposed from a medical aid into a military asset without provoking widespread concern. But neutrality carried hidden dangers. Because cocaine did not alarm the public, early signs of misuse were ignored. Teachers, noticed restless students but blamed stress. Employers observed workers pushing past their limits but viewed it as dedication. Doctors saw jittery patients and attributed symptoms to overwork. The drug's lack of reputation made its effects harder to identify, harder to challenge, and harder to control. This cultural blind spot intersected with the ambitions of the Nazi state, a regime that prized strength, speed, and endurance above all else, had little reason to hesitate when a stimulant offered the possibility of enhancing all three. The fact that the drug lacked controversy made it easier to fold into military planning. A substance without moral weight could be molded into whatever purpose the state required. By the time war approached, cocaine had become more than a pharmaceutical tool. It had become invisible. A stimulant with powerful effects carried no social warning, no public suspicion, no instinctive fear. It moved quietly through pharmacies, hospitals, neighborhoods, and barracks. And that invisibility would be its most dangerous quality, as a nation on the edge of war prepared to put the drug to a use no civilian doctor had ever imagined. By the late 1930s, Germany's military and medical leadership had reached an informal consensus. Stimulants were not a curiosity, not an experiment, but a practical asset. What remained was the bureaucratic step that transformed scattered field tests and quiet pharmaceutical interest into official military policy. This moment, the final green light, did not arrive with fanfare or public declarations. It emerged through internal memos, classified reports, and the subtle alignment of institutions that were preparing for total war. The process began within the medical branches of the Wehrmacht, where officers reviewed field trial results with a mixture of caution and ambition. Reports from infantry exercises documented extended wakefulness, improved night march performance, and heightened alertness during simulated combat. Though the accounts mentioned side effects, agitation, restlessness, sudden fatigue after the stimulant faded, these concerns were framed as manageable issues rather than warnings. The tone of the documentation reflected the larger atmosphere in the country. Efficiency mattered more than hesitation. The High Command viewed these findings through a strategic lens. Adolf Hitler's vision of blitzkrieg demanded speed and uninterrupted momentum. Tanks, aircraft, and mechanized infantry had to move in coordinated surges that overwhelmed the enemy before defenses could solidify. Natural sleep cycles were incompatible with of such tactics. Generals argued that if a pharmaceutical tool could allow a division to advance through the night, the advantage was undeniable. They spoke of operational continuity, sustained readiness, and extended combat intervals, phrases that reached beyond medicine into doctrine. To support these ambitions, representatives from major pharmaceutical companies were invited to quiet consultations. Executives and chemists attended in tailored suits, presenting production models, purity guarantees, and packaging options suited for military distribution. The companies, already intertwined with the state through economic agreements, understood the direction of the conversation. They promised scalability, reliability, and discretion. Military officers, satisfied with the logistical efficiency, began drafting requirements for large-scale acquisition. Within the medical corps, debate had grown noticeably quieter. The traditionalists, those who still urged restraint, found themselves sidelined in committees, their reports filed away without comment. Official evaluations increasingly emphasized operational benefits and performance enhancement. Ethical considerations became footnotes. The language of medicine was shifting into the language of war. The final authorization did not come in a single dramatic order. Instead, it unfolded through a sequence of signed approvals. A directive for the procurement of stimulant were tablets, a memorandum instructing field medics on their proper and controlled distribution, a supply chain order integrating pharmaceuticals into rations and equipment lists. Each document appeared routine on its own, merely another item in the swelling bureaucracy of a nation preparing for conflict. But together, they constituted a decisive turning point. What had once been a medical tool was now a sanctioned element of military readiness. Unit commanders soon received sealed packets detailing dosage recommendations and operational scenarios in which stimulants could be used. These instructions emphasized discipline, avoiding the appearance of carelessness, yet acknowledged openly that the drug would be deployed during long marches, night operations, and critical moments requiring sustained concentration. Officers were advised to monitor behavioral changes, but given no guidance on long-term effects, largely because the studies did not exist. As production ramped up and crates began moving quietly through supply depots, the military disguised the procurement under generic medical logistics. Soldiers receiving the tablets during training were told they were performance aids, nothing more. There was no effort to cloak the drug in secrecy, simply an understanding that questioning it was unnecessary and perhaps unwise in the rigid hierarchy of the Wehrmacht. And with that, the shift was complete. The stimulant that had once circulated through pharmacies, clinics, and university labs now stood poised to enter the battlefield as a sanctioned component of war. The final green light had been given not with a proclamation, but with a quiet, bureaucratic nod that would reshape the endurance, the judgment, and ultimately the fate of thousands of soldiers marching toward a conflict unlike any the world had seen. The drug was no longer a possibility. It was policy. When the Wehrmacht moved from theoretical planning to direct experimentation, the first field trials of cocaine unfolded in controlled but realistic military environments. These trials were not announced, not recorded in public documents, and certainly not disclosed to the soldiers involved. They began quietly framed as routine endurance assessments on training grounds where recruits pushed their bodies under conditions meant to mirror the hardships of war. One of the earliest documented tests took place on a cold, overcast morning in central Germany. A reconnaissance company was ordered to embark on an extended march across uneven terrain. The men, unaware of the experiment, received what their medics described as alertness tablets, pressed into their hands along with standard rations. Instructors tracked their progress with notebooks, watches, and binoculars, noting how long each soldier maintained pace, how alert they remained during brief rest stops, and how quickly they reacted to sudden commands. The initial results were striking. The stimulant did exactly what the medical corps expected. It pushed the men past normal fatigue thresholds. Soldiers who struggled during previous exercises suddenly moved with renewed energy. Their eyes stayed wide, their attention fixed, and their pace more consistent. Some even appeared euphoric, joking, laughing, or marching with an intensity that caught their sergeants by surprise. For the officers observing, from ridge lines and trucks, the drug seemed to validate the military's gamble, but the cracks appeared just as quickly. After hours of steady movement, a small group of soldiers grew irritable and short-tempered. Minor disagreements escalated into sharp arguments. One recruit, previously calm and compliant, refused an order and shouted at his superior before regaining his composure seconds later, confused by his own behavior. Another reported his heart pounding like artillery, though his pulse eventually stabilized. Yet these incidents barely made it into the final reports. The supervising officers, influenced by strategic expectations, classified them as emotional fluctuations or training stress. What they highlighted instead were the measurable outcomes: improved march times, increased alertness, and reduced need for rest. Other trials soon followed. Armored units tested the drug during long operations inside tank simulators. Drivers, often exhausted by the sensory strain of enclosed metal compartments and constant engine vibration, showed notable improvements in reaction time. Their instructors pushed them to operate for longer intervals, recording how focus and coordination held under chemical stimulation. Again, the positive results overshadowed the side effects: jitteriness, impatience, and occasional impulsive decisions during simulated combat scenarios. The Luftwaffe conducted its own tests. Pilots flying extended training routes reported enhanced concentration during navigation and target spotting drills. Several even remarked that colors seemed sharper, the horizon more vivid. These comments intrigued flight surgeons, who interpreted them as signs of increased sensory awareness. Only later did some officers quietly note that heightened perception sometimes blurred into overstimulation, making pilots overconfident in maneuvers that required precision, not bravado. Despite these concerns, momentum continued to build. The High Command received summaries emphasizing that stimulants allowed units to maintain operational tempo far beyond natural endurance. Senior officers preparing for lightning warfare saw these findings not as medical phenomena, but as tactical assets. What the first field trials truly revealed, though the military chose not to dwell on it, was a simple but dangerous truth. The drug could elevate performance, but at the cost of stability. It sharpened the mind, even as it frayed emotional control. It prolonged endurance, even as it distorted natural limits. It made soldiers faster, but not necessarily wiser. Still, in a nation preparing for war under a regime that valued speed and obedience above caution, these warnings carried little weight. The stimulant had passed its first tests, not because it was safe, but because it was useful. Among all branches of the German military, the Luftwaffe felt the pressure of impending war most intensely. Air combat demanded precision, reflex, and relentless concentration qualities that fatigue eroded quickly. Pilots were expected to endure long reconnaissance missions, sudden scramble, alerts, and extended aerial engagements that taxed the limits of human endurance. By the late 1930s, Luftwaffe medical officers had begun to ask a direct, unsettling question. Could chemistry keep pilots sharper for longer? The first endurance experiments were framed as routine evaluations. Pilots assigned to night-flying units were instructed to undertake extended training routes across Germany, tracing waterways, ridges, and railway lines from sunset until dawn. Before takeoff, medical personnel handed each pilot a small tablet, describing it only as a fatigue countermeasure. Most accepted it without hesitation. Military culture rewarded compliance, and pilots trained to follow procedure with strict discipline rarely questioned a medical directive. The effects were immediate and, at first glance, impressive. Pilots reported heightened alertness, sharper vision, and a sense of mental clarity that held firm long after they would normally begin to tire. Navigation tasks that typically strained attention became easier. Complex radio communications felt simpler. Some pilots said they could feel incoming turbulence before their instruments registered it, a comment that flight surgeons interpreted cautiously but with interest. In observation towers, instructors tracked the aircraft through the night sky. They noted fewer altitude deviations, more consistent turn execution, and tighter formation flying. Aerial photographs taken during endurance missions showed clear, crisp images, even in the early morning hours when fatigue usually dulled reflexes. On paper, the stimulant seemed to enhance performance across every metric that mattered, but in the debriefing rooms, the darker side of the trials emerged. Pilots described not only heightened clarity but also a strange, buzzing confidence, a feeling of invincibility that edged dangerously close to recklessness. One lieutenant admitted he took a steep banking maneuver just to feel alive, despite strict orders to avoid unnecessary risks. Another confessed that he felt an overwhelming urge to push his aircraft faster, as though speed itself had become a form of escape. More troubling were the crashes after the stimulant faded. Several pilots landed with trembling hands, exhausted beyond anything they had experienced previously. The stimulant had postponed fatigue, not eliminated it. When the effects wore off, exhaustion hit with crushing force. In one documented case, a pilot collapsed beside his aircraft, moments after touching down, unable to stand without assistance. The medical report listed severe post-stimulant fatigue, but concluded the episode was operationally acceptable. Even more concerning was the growing pattern of agitation among certain test subjects. During simulator drills, a few pilots displayed bursts of irritability or impatience that impaired teamwork. One veteran airman known for his calm demeanor erupted in anger during a training discussion, startling his fellow officers. His behavior returned to normal hours later, but the incident was quietly noted. Despite these warnings, Luftwaffe leadership saw only the strategic benefits. Germany's air doctrine relied on rapid response interceptors scrambling at all hours, reconnaissance crews flying long loops over enemy territory, and bomber units moving faster than opposing defenses could respond. A chemically supported pilot force promised a decisive edge. The concerns of flight surgeons were acknowledged, but carried little weight beside the promise of expanded operational capacity. Pharmaceutical companies fed the momentum. Representatives assured military officials that purity levels could be standardized for aviation use and that side effects were within manageable parameters. Their confidence, grounded more in commercial ambition than medical ethics, helped smooth the path toward wider adoption. By the time the experiments concluded, the conclusions were clear officially, at least. Stimulants increased endurance, improved night flying accuracy, and kept pilots alert during extended missions. The risks were minimized in the final summaries, described as temporary fluctuations in behavior or post-operational fatigue. Privately, some flight surgeons worried they were helping create pilots who could outfly their own judgment, but the Luftwaffe, preparing for a war built on speed and surprise, had no intention of slowing down. The stimulant had proven its worth in the skies. Soon, it would move from experimental tool to standard issue, reshaping the psychology, performance, and fate of the men who carried Germany's war into the clouds. While the Luftwaffe experimented with stimulants in the skies, the Wehrmacht's infantry faced a far more grounded challenge: endurance on foot. Blitzkrieg doctrine demanded relentless forward momentum, infantry units moving in close coordination with armor, often covering vast distances with little rest. The High Command believed that speed would decide the next war. If soldiers could march farther, faster, and with fewer pauses, Germany's armies could overwhelm opponents before defensive lines solidified. To achieve that speed, the infantry became one of the first branches to receive systematic stimulant testing. The trials were integrated into routine field exercises, concealed behind the language of discipline and readiness. Recruits were told they would undertake extended mobility operations, a vague phrase that masked the experiments beneath them. Before departing, platoon medics distributed small white tablets with instructions to swallow them before the march and again halfway through. Officially, they were fatigue stabilizers. Unofficially, they were controlled doses of cocaine. The early results were dramatic. Companies that usually slowed after 20 kilometers maintained pace deep into the night. Soldiers who had previously struggled on long marches now moved with surprising vigor. Boots struck the frozen ground with steady rhythm. Breath clouds mingled with fog as the long columns advanced through forests, fields, and muddy roads. Commanders watching from the roadside saw ranks that should have been winding down instead accelerating. Officers wrote glowing notes, morale unusually high during final phase. Unit displayed exceptional cohesion despite distance. Alertness remained constant throughout nocturnal movement, but beneath the surface of these successes, troubling patterns emerged. Some soldiers became overly enthusiastic, singing loudly, cracking jokes, or pushing ahead of formation. Others displayed a brittle edge, snapping at small provocations. In several platoons, heated arguments broke out over trivial issues like marching order or pack weight. These incidents were documented, but lightly. The reports framed them as behavioral fluctuations under increased load, careful phrasing that avoided acknowledging the true cause. As the march extended past the midpoint, the stimulant's psychological effects intensified. A few soldiers began describing strange sensations, a buzzing in the limbs, the feeling of their hearts pounding too fast, a sense that the night air was unnaturally sharp, the belief that they could march indefinitely. These comments worried some medics, but the operational results were too valuable to dismiss. Units covered distances once considered impossible for standard infantry. Instructors recorded march times that surpassed every previous benchmark. Stimulants, it seemed, offered a shortcut to the kind of endurance that months of training could not reliably produce. Then came the crashes. When the stimulant finally wore off, the collapse was severe. Soldiers who had marched confidently through the night suddenly staggered. Knees buckled, hands trembled, fatigue struck with overwhelming force, draining strength in an instant. Several men collapsed beside their gear, unable to continue without assistance. Others became disoriented, unable to recall segments of the march or respond coherently to questions. Medics documented these cases quietly. To acknowledge them openly would mean questioning the entire program, which had already gained support from high-ranking officers. The internal reports softened the language. Acute fatigue following exertion, temporary disorientation, short-term stamina deficit. None of these phrases captured the truth. The soldiers were experiencing chemical crashes severe enough to impair judgment and physical stability. Yet, even with these incidents, the momentum behind stimulant use continued to build. The operational gains were too tempting. Blitzkrieg required unbroken movement. If chemistry could sustain that momentum, the risks were seen as acceptable, or at least dismissible. In the end, the infantry trials provided the military with exactly what it wanted: proof that stimulants could stretch human endurance far beyond natural limits. The warnings, though documented, were buried among pages of data praising improved performance. The German infantry could now march longer, faster, and deeper into enemy territory. But the cost, physical, psychological, and ethical, had already begun to reveal itself, even if the army chose not to look closely. What mattered most to the high command was simple. The drug worked, and soon it would be used not just on exercises but on the battlefield. As stimulant trials expanded across the Wehrmacht, a new idea began to take hold within the upper levels of Germany's military and scientific establishment, a concept that blended ideology, medicine, and ambition into a single dangerous vision. It became known informally among officers and to researchers as the perfect soldier theory, the belief that human limitations were obstacles to be overcome, not through rest, discipline, or training, but through chemistry. This idea did not emerge in a vacuum. It grew from a convergence of three forces shaping Nazi Germany at the end of the 1930s. First was ideology. National Socialism preached the supremacy of willpower, purity, and strength. The regime believed the German soldier embodied these ideals: disciplined, obedient, tireless. Reality, however, did not always match the myth. Soldiers fatigued. They hesitated. They succumbed to fear. To the regime's leaders, these weaknesses were defects to be corrected. If chemistry could suppress fear or push back exhaustion, then stimulants were not merely tools, they were instruments of ideological fulfillment. Second was military necessity. Blitzkrieg demanded non-stop movement tanks advancing, infantry keeping pace, pilots flying mission after mission. Commanders understood that victory depended on speed, timing, and overwhelming shock. But speed came at a cost. Exhaustion slowed operations and created vulnerabilities. The idea of a soldier who could operate effectively for days without rest fit perfectly into strategic plans for rapid domination. Third was scientific ambition. Germany's medical community, already respected worldwide, found itself increasingly encouraged to pursue experimental avenues. Young researchers, eager to prove themselves, saw stimulants as a frontier where biology and national interest intersected. In laboratories funded by the state, the idea of chemically enhanced soldiers shifted from theoretical discussion to practical experimentation. Together, these forces created a powerful narrative that human performance could be engineered, augmented, and controlled. By 1939, the perfect soldier theory had become a topic whispered in officers' clubs and discussed openly in certain research circles. Military journals published cautious articles about enhanced operational efficiency and pharmacological support for combat readiness. Though these papers avoided explicit references to stimulants, the implications were clear to anyone familiar with the ongoing trials. Internal memoranda from the medical corps became increasingly optimistic. One report concluded that stimulants may support the maintenance of combat effectiveness during periods in which rest is tactically impossible. Another suggested that, with proper dosing, soldiers could maintain alertness through multiple consecutive operational cycles. The language was clinical, but the vision it supported was unmistakably bold. Not all officers embraced the idea. Veterans of the First World War, men who had learned the hard limits of human endurance in the trenches, expressed skepticism. Some argued that artificial stamina masked deeper vulnerabilities and could lead to reckless decision-making under fire. Others worried that dependency would undermine discipline, but these concerns rarely reached the top. The regime favored arguments that aligned with its ambitions. In closed-door meetings, senior officials began to speak of a future army unhindered by weakness. They imagined divisions moving with machine-like precision, soldiers immune to fatigue, fear, or hesitation. The line between man and weapon blurred in their discussions. Stimulants were not merely aids, they were enhancements, the first step in a larger project to optimize the German fighting force. Behind these discussions were real soldiers, young men who trusted the military implicitly. Most came from farms, factories, and small towns. They believed in duty and followed orders without question. Few understood that the tablets pressed into their hands during exercises were part of a broader experiment to redesign human capability. The theory of the perfect soldier was intoxicating to those who crafted strategy from distant map rooms and laboratories. They saw only the potential advantages, never the psychological fractures, the crashes, or the slow erosion of judgment that frontline physicians quietly noted. In the years to come, this theory would shape decisions on battlefields across Europe. It would influence how units advanced, how long they fought, and how far commanders pushed their men before allowing rest. And in many cases, it would lead soldiers into situations where their chemically extended endurance outpaced their capacity for reason. The dream of the perfect soldier was a fantasy one, forged from ideology, ambition, and scientific overconfidence. But like many fantasies born in wartime, it would leave a very real and very human cost in its wake. While the Wehrmacht refined its theories and field tests, another machinery, colder, louder, and far more expansive, began turning with increasing momentum across Germany. This machinery was industrial, and it formed the backbone of the stimulant program long before the first soldier carried a tablet into battle. The factories of the Reich, already mobilizing for war, became the silent engines producing the chemical tools of endurance. Throughout the late 1930s, Germany's pharmaceutical giants expanded rapidly under state directives. These companies, many already international leaders in chemical production, worked closely with the Nazi government to meet escalating military demands. Stimulants, once produced in modest quantities for civilian use, now rolled off assembly lines by the millions. What had once been measured in grams became measured in tons. Inside the factories, the work was methodical. White-coated chemists oversaw long rows of steel vats, where raw materials were refined into crystalline powders. Technicians monitored temperatures, pressures, and reaction times with precision. Quality inspectors checked purity levels under bright lamps, ensuring each batch met military standards. The process was clinical, scientific, and detached. The workers focused on chemical formulas and production quotas, not on the ethical consequences of their output. The factories themselves were sprawling complexes of brick, concrete, and smoke. Stacks, conveyor belts carried sealed boxes of tablets past teams of packers who stacked them into crates marked medical supplies. Truck engines rumbled outside loading docks as shipments traveled to depots across the country. Rail lines, secured by the state, moved pharmaceuticals alongside, ammunition, fuel, and rations. In the eyes of the regime, Stimulants were simply another logistical component of modern war. Company executives met regularly with government officials. Minutes from these meetings, later recovered in fragments, reveal discussions framed entirely around efficiency and capacity. Production targets were increased repeatedly. Questions of dependency, safety, or long-term effects never appeared in the records. Instead, the dialogue centered on supply chain resilience, how quickly factories could replace shipments lost to air raids, how to secure raw materials if borders closed, how to ensure uninterrupted output even as the nation mobilized for conflict. The state rewarded loyalty. Factories that met their quotas received tax incentives, additional labor allocations, and political protection. Some executives joined the Nazi Party not out of ideology, but because alignment with the regime ensured access to resources and influence. Their factories became symbols of national strength, industrial fortresses, producing the substances that would fuel Germany's war machine. Meanwhile, smaller facilities, once devoted to everyday pharmaceuticals, were quietly repurposed. Local chemists found themselves manufacturing stimulant tablets instead of cough syrups. Some complied willingly, viewing their work as patriotic. Others complied out of necessity. Refusal meant scrutiny, and scrutiny under totalitarian rule carried consequences. The transformation was rapid, comprehensive, and almost invisible to the general public. Inside these repurposed factories, workers noticed subtle shifts. Production schedules lengthened, supervisors pushed harder, security tightened, military liaisons appeared on site, asking technical questions and inspecting shipments with clipboard precision. No explanations were given, but none were needed. Everyone understood Germany was preparing for war, and that their labor, whatever its nature, served a national purpose. By the time war approached, the stimulant program had become self-sustaining. Factories were running at full capacity, producing tablets that would soon be issued across the Wehrmacht. The infrastructure was complete. Raw materials, processing plants, packaging, distribution, and oversight, all synchronized under state authority. But the industrial efficiency masked deeper consequences. As factories scaled production, purity rose, and dosages stabilized, making the drug more potent, more predictable, and more dangerous in military contexts. The very qualities that made the stimulant appealing to commanders heightened its risks for soldiers, who would consume it on the front lines. The factories of the Reich had achieved something unprecedented. They had transformed a once medical stimulant into a mass-produced instrument of war, manufactured with the same ruthless precision as bullets and artillery shells. And soon, those tablets, born of chemistry, industry, and ambition, would shape the endurance, judgment, and fate of millions of men advancing into a conflict that demanded more from them than any chemical could safely provide. As stimulant production scaled across Germany, the final barrier between chemical experimentation and military deployment should have been medical ethics. In another era, under another government, the medical corps, university boards, and civilian regulators would have scrutinized the psychological and physiological consequences of widespread stimulant use. They would have debated, delayed, or rejected policies that exposed soldiers to dependency and impaired judgment. But in Nazi Germany, the role of medical ethics was not simply diminished, it was systematically dismantled. The transformation began quietly. When the National Socialists seized control in 1933, they rewrote the relationship between medicine and the state. Doctors were no longer independent professionals. They became instruments of national policy. Academic appointments required political loyalty. Research grants flowed to those whose work aligned with party goals. Ethical review committees, once designed to restrain dangerous experimentation, were reorganized under party loyalists who prioritized utility over caution. Even prominent physicians who voiced concerns found themselves transferred, silenced, or replaced. Within this environment, the stimulant program moved through the medical establishment with dangerous ease. Professorial debates about dependency or long-term neurological effects faded. Few dared to publish critical papers. Those who did encountered rapid professional consequences, lost positions, revoked funding, or forced retirement. The regime framed hesitation as weakness and portrayed scientific caution as resistance to national renewal. In a country increasingly governed by fear and obedience, dissent became a professional death sentence. Military medical officers, many of whom entered their positions with genuine intentions to heal, now found themselves navigating a landscape where ethical concerns were interpreted as political disloyalty. Their duty was reshaped. They were to enhance fighting strength, maintain wartime efficiency, and follow directives from above. The Hippocratic Oath quietly gave way to a doctrine of obedience. Training manuals changed accordingly. New editions emphasized the importance of operational readiness and maximum performance under strain. Chapters discussing psychological well-being were shortened. Sections on long-term health risks vanished entirely. Instead, medical personnel were instructed to monitor soldiers for temporary behavioral disturbances and to address them with discipline, not diagnosis. The language reflected a chilling shift. Health was subordinate to utility. In military hospitals, this shift became deeply visible. Doctors who once worried about exhaustion now focused on how to mask it. Surgeons and psychiatrists who noticed stimulant-induced agitation documented it in vague terms, avoiding any suggestion that the drug itself might be harmful. Their reports were filtered through political channels before reaching higher command, with troubling findings softened or removed. The truth weakened as it ascended the hierarchy. Some physicians resisted quietly. They tried to warn colleagues, writing careful notes in private journals or speaking in guarded conversations behind closed office doors. A few recorded specific cases: soldiers suffering violent mood swings, anxiety attacks, or psychotic episodes after sustained stimulant use. These doctors recognized the pattern. They saw the dependency forming. They knew the danger. But they also knew the risks of speaking openly. Under dictatorship, moral clarity became a liability. Meanwhile, military leadership presented stimulants as a scientific triumph. They praised the medical corps for discovering ways to extend soldier endurance and maximize operational precision. Public statements depicted the German soldier as a paragon of strength and will, the perfect embodiment of Nazi ideology, without mentioning that chemistry, not character, often sustained that image. The stimulant program became a quiet propaganda tool, hidden behind rhetoric about superior discipline and racial vigor. By the time the war began, the ethical framework that should have protected soldiers had collapsed entirely. There were no informed consent protocols, no long-term studies, no mechanisms for reporting adverse reactions without political repercussions. Soldiers became test subjects in a living experiment, one justified by military ambition and enabled by an ethical vacuum. The dictatorship did not merely ignore medical ethics, it rewrote them. Under its rule, the question of whether a drug was safe became irrelevant. The only question that mattered was whether it worked. And because stimulants appeared to work, at least on paper, the system endorsed them, producing the illusion of strength while eroding the very men who carried Germany's war on their shoulders. In the shadows of laboratories and military hospitals, the cost of that illusion grew unseen, unspoken, and unstoppable. As Germany edged closer to war, the distribution of stimulants evolved from a series of controlled experiments into a shadow logistics network woven quietly into the fabric of the Reich's supply system. It did not resemble the dramatic smuggling routes of fiction. Instead, it grew slowly, methodically, and almost invisibly hidden in plain sight among crates of food, medical kits, ammunition, and field equipment. The stimulants moved across Germany the same way the army did, with discipline, precision, and a single overarching purpose. The system began with the factories. Once, tablets were sealed in tins or paper-wrapped bundles. They were placed into standard medical crates, designed to blend seamlessly with other equipment. Labels avoided specific wording. The contents were marked only as K-issue medical supplements, a deliberately vague term that could pass through checkpoints without scrutiny. Workers on the factory floors never spoke about their purpose. Most didn't know. Those who suspected learned to stay silent. From the factories, shipments moved by rail, the backbone of Germany's war machine. Trains carrying ammunition, fuel, uniforms, and machine parts now carried stimulant crates as well. Boxcars bound for Wehrmacht depots often included small compartments reserved for medical supplies. Railway workers, accustomed to strict oversight by military police, followed paperwork without question. The stimulant crates carried the same stamps, signatures, and codes as legitimate medication. In a logistics system built on obedience, concealment became effortless. At major railway hubs, the stimulant shipments merged into larger supply flows. Quartermasters sorted crates not by their contents but by destination. Eastern Command, depots, Western staging areas, Luftwaffe airfields, or naval harbours. Because the stimulant program lacked public controversy or political risk, there was no need for secrecy in the traditional sense. Its concealment came from the mundane bureaucracy, routine, and the sheer volume of supplies moving across Germany each day. Inside depots, medical officers received the crates as part of their standard inventory. They logged them, sealed them, and stored them beside bandages, quinine, antiseptics, and sulfur drugs. Soldiers assigned to warehouse duty often stacked thousands of such crates, without knowing which held stimulants and which held nothing more dangerous than iodine. The anonymity of the packaging ensured that only senior medical staff understood which shipments could alter a soldier's endurance, mood, or judgment. From these hubs, the stimulants travelled in military trucks to frontline units. Drivers transported everything from bread to artillery shells, and stimulant crates blended naturally into these mixed loads. Road convoys, protected by armed escorts, moved steadily toward regiments preparing for deployment. The stimulant packets inside the trucks were simply one more item among many unremarkable to the men escorting them, invaluable to the officers awaiting their arrival. At the regimental level, distribution became more deliberate. Field medics received tins of tablets in sealed envelopes marked with dosage instructions. Some officers used them sparingly, reserving them for night marches or emergency operations. Others adopted a more liberal approach, convinced that stimulants were a reliable way to keep soldiers sharp. A few commanders, driven by ambition or fear of failure, instructed medics to issue tablets preemptively before demanding maneuvers. Their discretion varied widely and dangerously. Despite their widespread movement, the stimulants left almost no trace on official paperwork. Reports described them as combat supplements or endurance aids, avoiding specific chemical terms that might raise questions. This vagueness was intentional. The regime understood that the fewer words written, the fewer opportunities existed for objections. What emerged was a logistical phenomenon, a supply chain that delivered a powerful psychoactive substance to soldiers with the same casual efficiency used to deliver bread. No secrecy was needed, no clandestine code names, no covert operatives. The stimulant program succeeded because it lived inside the ordinary. But behind the ordinariness was a stark truth. Once the supply lines began flowing, there was no mechanism to stop them. No system existed to track consumption, monitor long-term effects, or identify misuse. The stimulants moved outward, deeper into the ranks, expanding their reach with every shipment. As Germany prepared to launch war across continents, the hidden supply lines ensured that soldiers would march, fly, drive, and fight, with chemistry coursing quietly through their veins. And the men who depended on these pills, some knowingly, some unknowingly, would soon learn that the strength they borrowed from the drug came with a cost the supply system never accounted for. As the stimulant program embedded itself deeper into the Wehrmacht's operations, the role of military physicians changed in ways that blurred the boundaries between medicine, command, and ideology. In the early years of the Reich, German doctors had been trained to diagnose, heal, and protect the welfare of their patients. But by the late 1930s, many of those same men now wore officers' uniforms, reported to generals, and were expected to view their work not through the lens of care, but through the logic of war. This transformation did not happen all at once. It unfolded, gradually, as the Nazi regime reshaped every institution according to its needs. Medical schools revised their curricula, placing greater emphasis on racial theory, physical endurance, and military utility. Young doctors were told that their highest calling was not merely to heal, but to strengthen the nation. When these men entered military service, they did so already conditioned to see their work as an extension of state power. Inside the Wehrmacht, doctors held rank literally. A physician might enter service as a Leutnant or Oberleutnant, later rising to Hauptmann or Major, depending on seniority and political reliability. Their uniforms carried the same insignia as combat officers. Their authority flowed from the chain of command, not from patient trust. This dual identity created a conflict at the heart of their duties. Were they healers, or were they strategists in the reckoning? Machinery of war? The stimulant program forced the question into the open. During training exercises, doctors were instructed to issue stimulant tablets under controlled conditions. But these conditions were defined by military necessity, not medical caution. When a commander ordered a night, march, or extended drill, the doctor's role was not to evaluate whether soldiers were too exhausted to continue. It was to provide the chemical means to make them continue. In effect, doctors became enforcers of endurance. This shift altered the doctor-soldier relationship in profound ways. Many soldiers trusted their physicians implicitly, believing that whatever a medical officer handed them was safe and necessary. They did not question orders, nor did they fully understand what they were taking. Doctors, aware of this trust, faced difficult decisions. Some administered the tablets with reluctance, conscious of the risks but unwilling or unable to contradict superior officers. Others embraced their new authority, seeing themselves as contributors to a stronger, faster fighting force. In medical tents and field offices, the tension played out daily. A doctor might treat a soldier for tremors or sudden agitation, knowing privately that the symptoms were stimulant-induced, but recording them generically as operational stress. Another might recommend a temporary rest only to have a commander override the decision, citing tactical needs. The uniforms, rank insignia, often outweighed the doctor's judgment. The regime's influence intensified this pressure. Military physicians were evaluated not merely on medical performance, but on ideological alignment and support for operational goals. Promotions favored those who complied with directives, emphasized benefits over risks, and demonstrated initiative in applying chemical aids to battlefield readiness. Those who hesitated risked being labeled unreliable, a dangerous designation in a system built on fear and obedience. Some doctors attempted quiet resistance. They issued smaller doses than prescribed, delayed distribution during non-critical operations, or cautioned soldiers privately about overuse. A few kept detailed private journals documenting cases of dependency, psychological breakdowns, or violent outbursts triggered by stimulants. These physicians recognized the ethical line they were crossing, but found no institutional support to step back from it. Yet others leaned fully into their militarized role, convinced that their duty was not to protect individual health, but to maximize fighting potential. To them, stimulants were no different from ammunition or fuel tools to be used decisively in the pursuit of victory. Their medical training became secondary to their identity as officers, and their diagnoses reflected command expectations rather than medical reality. By the time Germany marched into Poland in 1939, the transformation was complete. Doctors were no longer independent guardians of soldier welfare. They were integrated components of the command structure. Their decisions were shaped by strategy, not conscience. Their authority served the state, not the patient. And in this militarized environment, Stimulants flowed unchecked, distributed by men whose uniforms made them symbols of trust, even as the chemicals they dispensed carried risks no one in command wished to acknowledge. The soldiers believed their doctors were protecting them. The doctors believed they were serving the nation. The regime believed both were functioning exactly as intended. But beneath the surface of this chain of obedience, the line between care and coercion had already disappeared. As stimulant use expanded through the ranks of the Wehrmacht, the list of observed side effects grew just as quickly. Soldiers experienced tremors, bursts of aggression, paranoia, heart palpitations, insomnia, and emotional volatility. Pilots became overconfident in maneuvers requiring precision. Infantrymen lashed out over minor disagreements. Tank crews reported episodes of tunnel vision during extended operations. Medics and doctors on the ground recognized these patterns for what they were: chemical consequences, not character flaws. But inside the labyrinth of Nazi bureaucracy, these warning signs were treated not as medical crises but as inconveniences, distractions from the strategic advantages the stimulants provided. The regime's leadership, committed to the idea of unstoppable momentum, framed side effects as temporary disturbances, nothing more. In an army preparing for total war, the human body was expected to obey, not falter. The denial began at the lowest levels, among junior officers pressured to maintain flawless readiness reports. When a soldier displayed erratic behavior after taking stimulants, superiors recorded it as combat stress, disciplinary lapse, or emotional strain under tactical load. The language was deliberately vague, allowing officers to sidestep the uncomfortable truth. They feared that acknowledging drug-induced instability would invite scrutiny they could not afford. Field medics found themselves in an impossible position. Their notebooks contained entries describing soldiers shaking uncontrollably after night marches, suffering from hallucinations after multi-day operations, or collapsing from post-stimulant crashes so severe they could barely stand. Some medics attempted to warn their superiors, but their concerns were dismissed as overreactions. They were told to treat symptoms, not causes, and reminded that military medicine existed to preserve combat strength, not to question high command directives. Higher up the chain, the denial hardened into policy. Medical reports sent to Berlin underwent review by officers trained not in medicine but in political discipline. Negative observations were often edited, softened, or removed entirely before reaching commanders. A report describing acute psychological instability following stimulant intake might be rewritten as short-term agitation under elevated operational strain. Another report noting compulsive redosing behavior would become voluntary request for extended support. Language became a shield, a way to turn dangerous truths into manageable fictions. Doctors who pressed, the issue faced consequences. Promotions stalled, transfers appeared without explanation. A few outspoken critics found themselves reassigned to distant posts or replaced quietly by more compliant officers. The message spread quickly. Raising concerns about stimulant-induced problems was a career-ending risk. The regime's propaganda machine deepened the denial. Newspapers and radio broadcasts romanticized the stamina and discipline of German soldiers, portraying them as embodiments of unwavering willpower. The idea that chemistry fueled these feats contradicted the myth of racial and ideological superiority, and so it remained hidden. Public narratives praised soldiers who fought through exhaustion, glossing over the chemical assistance quietly issued by their medical units. Meanwhile, inside Germany's research institutions, a few pharmacologists continued to document the drug's risks. They found correlations between heavy stimulant use and erratic decision-making, anxiety, cardiovascular stress, and dependency. But their reports stayed locked in filing cabinets, marked restricted circulation. The war effort had no room for findings that suggested weakness. Even among those who understood the dangers, denial became a coping mechanism. Military physicians who once worried about long-term health effects told themselves that victory would justify the cost. Officers who witnessed breakdowns convinced themselves those soldiers were outliers. Commanders pushing their units past human limits believed they were doing what was necessary, that the enemy would show no mercy, and therefore neither could they. By the time the war erupted across Europe, denial had become institutional doctrine. The side effects, physical, psychological, moral, were buried beneath layers of bureaucracy, propaganda, and fear. Soldiers suffered in silence. Doctors recorded their symptoms in whispers, and officers pretended not to see the cracks forming in the men they commanded. The stimulant program had promised strength, but in refusing to confront its consequences, the Wehrmacht began to build its war machine on a foundation of chemical illusion. The price of that illusion was already mounting, hidden in the tremors, the sleepless nights, the sudden bursts of anger, and the quiet despair of men pushing themselves far beyond the limits nature intended. By the time the first shots of the coming war echoed across Europe, the stimulant program inside the Wehrmacht no longer resembled a collection of isolated experiments or provisional field tests. It had become official policy codified through a discreet but decisive medical directive issued from the upper tiers of the military's health administration. This document, circulated only among officers and medical personnel with appropriate clearance, formalized what had been happening informally for years. Stimulants were now recognized as an authorized component of combat readiness. The directive itself ran only a few pages. It avoided explicit reference to cocaine, instead using euphemistic terms such as Wachhaltmittel, wake maintenance agents, or leistungssteigernde Unterstützung, performance-enhancing support. This phrasing allowed the program to exist in plain sight within military paperwork without attracting attention. The language was clinical, efficient, and intentionally vague, designed to blend into the sea of logistical and medical documents that guided the Wehrmacht's daily operations. Its instructions, however, were unmistakably clear. Doctors were to issue stimulants during extended operational intervals when fatigue threatened to reduce combat efficiency. Infantry units were authorized to use them during night marches, breakthrough operations, and periods of rapid maneuver. Tank crews were instructed to utilize them during long armored pushes, especially when natural sleep cycles became disrupted. Luftwaffe pilots were advised to take them before extended reconnaissance flights or prolonged air defense patrols. The directive framed stimulant use as a matter of necessity rather than choice. For medical officers, it became another order to follow an expectation woven into duty, discipline, and the hierarchy of command. The language emphasized that stimulants were combat multipliers, tools to preserve unit cohesion and strategic momentum. Nowhere did it mention the risks already documented in the field, the crashes, the agitation, the psychological instability, or the mounting signs of dependency. Accompanying the directive was a set of dosage guidelines, presented as precise medical instruction. Field medics were told how many tablets to issue per man, in what intervals, under which conditions. These guidelines gave the illusion of scientific rigor, masking the uncomfortable reality that the long-term effects of repeated use had never been systematically studied. The dosages were recommendations built on incomplete data, but presented with the authoritative weight of military science. The directive also instructed unit commanders to monitor behavioral changes, but provided no mechanism for reporting or addressing them. Commanders, already overwhelmed by training demands and administrative burdens, saw the stimulant supply as just another logistical responsibility. Many viewed it favorably, an asset that let them push their men harder, extend marches, or execute rapid maneuvers without pause. Few questioned it. In an army built on obedience and ideology, the directive's authority silenced doubt before it could gain traction. One of the most revealing aspects of the directive was its distribution pattern. It bypassed civilian medical institutions entirely. It flowed through military channels alone, reinforcing the idea that stimulant use was not a public health matter, but a strategic innovation. Doctors in the civilian world, already marginalized, had no voice in shaping or critiquing the program. The Wehrmacht had insulated itself from outside scrutiny. At the highest levels, the directive served another purpose. It tied medical officers more tightly to the war effort. By placing stimulant distribution under their responsibility, the regime transformed them into instruments of military efficiency. A doctor who hesitated was not merely cautious, he was obstructing operational readiness. The directive's phrasing made reluctance indistinguishable from disobedience. Once it was issued, the stimulant program accelerated rapidly. Distribution became standardized. Reporting became routine, no longer dependent on individual initiative or unofficial requests. Stimulants flowed through supply lines as reliably as ammunition or fuel. Soldiers entering the war would soon take the tablets as casually as they shouldered their rifles, unaware that their bodies had already been drafted into a chemical strategy crafted far from the front. The official directive marked a turning point, the moment when chemical endurance ceased to be an experiment and became formal policy. Its implications extended far beyond paperwork. It redefined the power relationship between medicine, the military, and the soldier. It institutionalized a dependence the army refused to acknowledge, and it ensured that when the war began in earnest, thousands of men would march into battle with stimulants tucked among their rations, agents of alertness, wrapped in the authority of the state. The directive carried no warnings, only instructions. When the war finally cracked open across Europe, the effects of the stimulant directive moved from training grounds and controlled tests into the unforgiving reality of combat. The theory behind chemical endurance had been polished in meeting rooms, refined in laboratories, and rehearsed in exercises. But it was only on the chaotic, mud-soaked roads of Poland and France that the true impact became visible. In these opening campaigns, stimulants were no longer supplemental. They became a silent engine driving the pace of the Wehrmacht's advance. The German war plan relied on speed, above all else. Blitzkrieg was designed to overwhelm, disorient, and break enemy lines before they could stabilize. That speed demanded more of the infantry than any other branch. Soldiers marched behind tanks at a pace meant to exhaust the enemy, not themselves. Unit diaries describe columns, moving through fog, rain, and darkness with surprising consistency. For many soldiers, the stimulant tablets tucked into their field kits became the difference between keeping up and falling behind. The effects were unmistakable. During the first major night advance toward Warsaw, platoon commanders reported that their men remained unusually alert even after 18 hours of continuous movement. In what would normally be the window where exhaustion set in, when steps grew heavier, heads drooped, and judgment dulled, the stimulant kept minds sharp and legs moving. Some soldiers later recalled that the night seemed unusually clear, their senses sharpened as if the darkness itself had thinned. Others spoke of a focused determination that felt almost unnatural, as though fatigue had been burned away from the inside. Commanders noted these improvements with satisfaction. Units arrived at staging points ahead of schedule. Positions meant to be captured at dawn were taken in the dead of night. Radios carried messages describing exceptional stamina and remarkable spirit. To officers trained in the rigid doctrines of the First World War, the advances seemed almost miraculous, a sign that Germany's new army, forged in ideology and supported by chemistry, had transcended the limitations of earlier conflicts. But beneath these successes, the stimulant's side effects followed closely. In the aftermath of long marches, medics treated soldiers whose hands shook uncontrollably while attempting to load rifles. Others grew unusually aggressive during minor disputes, arguments flaring into fistfights over issues as trivial as marching order or the distribution of rations. Doctors recorded these cases quietly, often attributing them to battle stress or transition shock rather than chemical interference. Even more troubling were the crashes. When the stimulant faded, the collapse was devastating. Soldiers who had marched all night with unnerving clarity now sank into sudden exhaustion, not gradual fatigue, but a specking down, sharp physiological shutdown. Some fell asleep moments after stopping, unable to remain upright. Others experienced confusion, disorientation, or delayed reaction times during critical moments. One medical officer recalled attending to a soldier who seemed alert and responsive, only to collapse mid-sentence as his body finally demanded the rest it had been denied. These incidents alarmed some officers, but many dismissed them as acceptable costs in a war defined by rapid movement. The stimulant had delivered what the doctrine required: relentless momentum, and as long as the advances continued, few questioned the method. Privately, however, certain medical staff expressed concern. They noted that soldiers who relied heavily on stimulants struggled to recover normal sleep rhythms. Some developed dependency patterns, requesting tablets even during routine movements. Others displayed signs of emotional instability, sudden irritability, bouts of paranoia, or intense anxiety during quiet moments. Yet, despite these growing concerns, no system existed to halt or even slow the stimulant's spread. The directive had become self-sustaining. Officers expected results, soldiers expected the chemical edge. And the machinery of war, fueled by ambition, ideology, and industrial supply, pushed forward without pause. The early victories created an illusion that endurance enhanced by stimulants was not only effective but sustainable. It masked the cracks forming in the physical and psychological foundations of the fighting force. It turned human limits into tactical assets without acknowledging the cost. In the first campaigns of the war, the stimulant allowed soldiers to march beyond their natural capacity, deeper, faster, and harder than their opponents imagined possible. But what the Wehrmacht celebrated as strength was, in reality, a fragile extension borrowed against the body's reserves. And the debt would come due. When Germany turned its attention toward the east, the stimulant program entered a new and far more punishing chapter. The invasion of the Soviet Union, Operation Barbarossa, stretched the Wehrmacht across vast distances, unforgiving terrain, and brutal weather conditions that tested every assumption the High Command had made about speed, endurance, and human capability. Here, more than anywhere else, the stimulants became not merely tools of efficiency, but instruments of survival. The Eastern Front demanded movement on a scale unprecedented in modern warfare. German infantry were expected to follow armoured spearheads across hundreds of kilometres of plains, forests, and marshland, often with little rest, unreliable supply lines, and roads that dissolved into mud under the weight of thousands of boots and vehicle tracks. The distances were vast, the terrain relentless, and the timetable unforgiving. Commanders pushed their divisions forward with ruthless determination, believing that hesitation would give the Soviet defences time to reorganize. Under these conditions, stimulants became routine. Medical officers issued tablets before long night marches, before extended reconnaissance missions, and during sudden orders to exploit breakthroughs. Soldiers took them before pushing through swamps thick with mosquitoes, before crossing rivers under fire, and before launching assaults on fortified villages, where resistance was fiercer than anything encountered in the West. The tablets were small, tasteless, and easily swallowed, but their impact on morale, stamina, and perception was profound. In the early days of the campaign, reports from the front described extraordinary feats. Units marched through the night, covering distances that should have taken twice as long. Reconnaissance teams navigated pitch-black forests with clear, almost unnerving alertness. Soldiers remained awake for 36, even 48 hours, their senses sharpened in ways they struggled to explain. Some later said that exhaustion felt distant, like something happening to someone else. Others recalled feeling emotionless, detached from hunger, cold, or fear. But the stimulant-driven endurance carried hidden costs. The march toward Minsk saw the first major wave of crashes. As the initial stimulant effects wore off, soldiers collapsed beside their rifles, falling asleep on dirt embankments or inside shattered barns, sometimes so deeply that officers struggled to wake them even under bombardment. Medics recorded cases of hallucinations, where men insisted they saw shapes moving in the tree line or believed they heard whispered voices in the afa, wind. These symptoms were quietly filed away as fatigue reactions, allowing commanders to maintain the illusion of control. As the army pushed deeper into Soviet territory, the strain intensified. The terrain became harsher. Summer heat scorched the open plains. Dust storms reduced visibility and filled lungs with grit. Water ran low, food grew scarce, nights brought sharp cold, and soldiers shivered under thin blankets, their bodies weakened by sleeplessness and chemical manipulation. The stimulants still helped them march, but they no longer masked the full brutality of the environment. Psychological fractures began to appear. Soldiers grew irritable, quick to anger, or unnaturally euphoric. Some displayed reckless confidence during assaults, charging positions with little regard for cover. Officers noted increases in disciplinary issues, ignoring orders, verbal outbursts, or sudden emotional breakdowns. A few soldiers refused to stop marching even when ordered to rest, their minds locked into a chemically driven momentum they could no longer control. Yet, despite these warning signs, the demands of the campaign left no room for reconsideration. The distances grew longer. The weather worsened. The Soviets resisted with increasing ferocity, and the High Command, obsessed with maintaining momentum, issued new directives that pushed soldiers harder, faster, deeper into a land that seemed endless. For many units, stimulants became the only means of meeting impossible expectations. They were used before night attacks, before desperate defensive stands, and during forced retreats through mud so thick it swallowed boots to the ankle. In the bitter early winter, soldiers took them simply to stay awake long enough to avoid freezing in their foxholes. In the east, stimulants no longer resembled an advantage. They resembled a crutch, one that masked weakness long enough to sustain the illusion of strength. The cold marches toward Moscow revealed something the High Command refused to acknowledge. Endurance purchased chemically was temporary, fragile, and dangerously seductive. It allowed the army to move farther than ever before, but at the cost of draining the very human reserves needed to survive the collapse that would follow. The East demanded more from the German soldier than any stimulant could provide, and, soon, the front would expose just how thin the line was between enhanced endurance and irreversible exhaustion. Long before the bitter cold of the Eastern Front tested the limits of stimulant-driven endurance, another battle had revealed the drug's influence in the sky. During the summer and autumn of 1940, as the Luftwaffe launched wave after wave of raids against Britain, the stimulant program quietly expanded into one of the most demanding theatres of the war, the air war above the Channel. For pilots, fatigue could be fatal. A moment's lapse in concentration, a second of delayed reaction, or a brief drift into drowsiness could mean death in a high-speed dive or an unseen enemy descending from the clouds. The Luftwaffe's leadership understood this well. They emphasized readiness, alertness, and split-second decision-making in every briefing. Pilots were told that victory in the air came down to muscle memory, sharpened by relentless training and, increasingly, by the tablets issued before takeoff. By this stage, stimulant use among pilots was no longer experimental. It was procedural. Flight surgeons distributed pills before long patrols, nighttime interception missions, and multi-hour bombing runs. Pilots swallowed them alongside their pre-flight coffee, seeing them as another component of the ritual that prepared them for combat. Few questioned the need. Fewer still understood the full consequences. The stimulant's effects were both beneficial and deceptive. During long routes over the Channel or the English countryside, pilots reported heightened visual acuity. They described the horizon as sharper, the ground features more distinct, and enemy aircraft easier to spot. Many claimed the stimulant helped them resist the monotony that came with flying for hours over dark water or endless fields. Boredom, one of The most dangerous threats in long-range aviation seemed to evaporate under chemical influence. For bomber crews, the stimulant helped maintain focus during the tense moments leading to target release. Navigators stayed alert through turbulence and poor visibility. Radiomen remained quick and responsive even after hours of constant communication. Gunners, perched inside cramped, vibrating turrets, reported improved concentration during air engagements, but the benefits were accompanied by cracks that widened as the Battle of Britain intensified. One of the most alarming effects was the surge in overconfidence. Pilots who normally measured risk with precision began taking dangerously steep climbs or diving aggressively into enemy formations without waiting for orders. The stimulant dulled their natural caution, giving them the illusion of control in situations that demanded strict discipline. Some pilots reported feeling invincible, a sensation that, in the skies above Britain, was often fatal. Combat reports quietly hint at moments where pilots misjudged altitude or closed in too quickly on enemy aircraft. Several crashes during routine landings involved pilots whose hands shook uncontrollably after long missions. Flight surgeons attributed these incidents to stress or operational fatigue, but many recognized the unmistakable signs of a chemical crash. Even more troubling were the psychological symptoms documented privately. Some pilots described auditory distortions, the hum of engines sounding too loud, too sharp, or strangely rhythmic. Others experienced brief moments of disorientation, especially after hours of flying through cloud banks. A few reported an unsettling surge of irritation or aggression during formation flying, leading to arguments in the briefing rooms after landing. These incidents were rarely connected officially to stimulant use, but experienced medical officers saw the pattern all too clearly. Despite these concerns, the demands of the air war left little room for restraint. The Luftwaffe faced mounting losses, increasingly long flights, and the need to maintain constant pressure on British defences. Every hour of alertness counted. Every mission required maximal focus, and so the stimulants flowed from airfields in France to makeshift bases inside occupied territory. Pilots carried tablets in small tins tucked into their flight suits, taking them before operations, during breaks between sorties, or even mid-mission with water from onboard flasks. The Luftwaffe leadership praised their endurance. Propaganda celebrated the iron nerves and unshakable will of German pilots. None mentioned that chemistry, not character, often sustained these feats. Stimulants helped the pilots of the Luftwaffe fight longer, fly farther, and push themselves beyond natural limits during one of the most intense aerial campaigns in history. But the skies over Britain also revealed the darker truth. The same chemical edge that kept pilots alive also pushed some of them straight toward disaster, not because they lacked skill, but because the drug blurred the boundary between heightened focus and dangerous illusion. Above the Channel, speed was strength, but clarity was life. And stimulants, in those crucial months, offered one at the cost of the other. Inside the steel confines of a German panzer, stimulant use took on a character all its own. Unlike infantry, who marched through open landscapes, or pilots who battled exhaustion in the sky, armoured crews lived and fought within metal chambers barely large enough to stand upright. The tank was a world of vibration, heat, fumes, and constant sensory overload, a place where fatigue accumulated quickly and silently. In this environment, stimulants became not just an aid, but increasingly a coping mechanism for the relentless pressure of mechanized warfare. A panzer crew operated as a single organism. The commander scanned the battlefield through narrow optics, issuing rapid orders. The gunner tracked targets with precision that demanded absolute focus. The loader worked with speed and rhythm, his hands moving automatically through smoke and flame. The driver, half blind at the controls, navigated terrain that could destroy the vehicle with one wrong turn. All of them depended on each other. All of them felt exhaustion at the same time, and all of them felt the stimulant's effects in the close air of a fighting compartment. The tablets were usually taken before long. Advances those periods when armoured divisions pushed deep into enemy territory. often outrunning infantry support. Crews swallowed them during dawn briefings or just before mounting up, trusting the medical officers who handed them out. Within an hour, the stimulant spread through their systems, sharpening senses dulled by lack of sleep and constant engine drone. Tank commanders were among the most affected. Many described an almost unnatural alertness, the battlefield appearing in crisp detail through their periscopes, distant movement catching their attention instantly. Some reported feeling as though time itself had slowed, giving them more moments to think before making decisions. In a profession where seconds meant survival, that clarity seemed invaluable. But the stimulant also amplified tension. Inside a Panzer, the noise was overwhelming, the roar of the engine, the grinding of gears, the whine of traversing turrets, and the deafening crack of main gun fire. Under stimulant influence, these sounds became sharper, more intrusive. Some gunners found themselves flinching at every metallic rattle. Loaders moved with mechanical intensity, sometimes shoving shells into the breech too forcefully, bruising their palms. Drivers grew impatient, snapping at commands or overcorrecting the tank's movements. In the chaos of armoured combat, these shifts mattered. A commander too eager might push the vehicle into exposed terrain. A gunner too energized might fire prematurely. A driver, too tense, might misjudge an obstacle and trap the tank in mud or debris. Small errors, multiplied across dozens of crews, shaped the outcomes of engagements. Then came the crashes devastating in the armoured world. After hours of operation, the stimulant's effects collapsed suddenly, leaving crews drained. Soldiers slumped in their seats, unable to maintain posture. Drivers' eyes fluttered shut, even as engines idled. Loaders' hands shook uncontrollably, slowing their ability to cycle rounds. Commanders, once sharp and confident, stared blankly through optics, struggling to think clearly. In several documented incidents, crews fell asleep inside their tanks during brief halts, unaware of the danger. Exhaustion made them vulnerable to artillery fire, ambushes, and mechanical failure. Medical officers who inspected the crews afterwards saw the same pattern they had witnessed among infantry: bodies pushed beyond their limits, minds fraying under pressure, chemical endurance collapsing into sudden inertia. Yet despite the risks, the stimulant remained in steady use. The Eastern Front demanded speed in pursuit, stamina during retreats, and unbroken focus in battles that stretched across days. The armoured division's engines of blitzkrieg could not afford hesitation. Their crews were expected to keep up with operational tempos that no human body could endure unaided. Some officers grew concerned. They observed erratic behaviour in tank crews, noted an uptick in avoidable errors, and warned about dependency. But as with other branches of the military, their concerns were drowned out by demands from above. The stimulant worked, and that was enough. In the end, the Armoured Corps became a stark symbol of the stimulant program's contradictions. Chemistry gave them speed, reaction time, and temporary clarity, but it also heightened stress, eroded discipline, and left them vulnerable at critical moments. Tanks could be repaired with spare parts. Crews could not. As the war intensified, these chemically strained armoured crews continued to fight inside their steel compartments, their endurance borrowed, their nerves frayed, and their futures uncertain. And the illusion of invincibility created by stimulants would soon collide with realities that no tablet could suppress. By the middle years of the war, the stimulant program had become so woven into the fabric of the Wehrmacht that its use appeared normal, almost mundane. Tablets sat in medical kits beside bandages and iodine, issued with the same routine efficiency. Soldiers expected them. Field medics dispensed them. Logistics officers stocked them. And commanders, pressed by impossible timetables and shifting fronts, faced a growing dilemma: whether to cling to the chemical advantage that kept their units moving, or acknowledge that the very tool sustaining their momentum was also undermining their soldiers' stability. For many officers, the choice did not feel like a choice at all. The pressures of wartime command were immense. Entire operations hinged on speed crossing rivers before bridges blew, seizing towns before enemy reinforcements arrived, completing encirclements before Soviet divisions slipped through gaps. Commanders lived under constant scrutiny, evaluated by superiors who demanded results and tolerated little hesitation. Under such conditions, stimulants appeared less like an option and more like a requirement for survival, both personal and professional. Reports reaching headquarters praised units that advanced farther and faster than expected. Commanders who delivered such results were rewarded with promotions or commendations. Those who failed often found themselves reassigned or reprimanded. In this climate, officers quickly understood that stimulant-driven endurance provided a competitive edge. The chemical boost helped fulfill impossible orders and, equally important, helped maintain the appearance of control. Yet when commanders looked closely, the cracks were impossible to ignore. Officers conducting nighttime inspections noticed that some soldiers trembled violently after extended marches. Others displayed alarming irritability, snapping at comrades, disobeying minor commands, or erupting in sudden outbursts that bordered on insubordination. A few soldiers, caught between stimulation and exhaustion, marched with glassy eyes, awake but not alert, present but not fully conscious. Commanders recognized these signs even if they avoided naming them. War had trained them to read their men with a precision that medicine sometimes lacked. The real dilemma crystallized during prolonged operations. Commanders watched as soldiers who had seemed supernaturally alert hours earlier now stumbled, their legs buckling beneath them. Entire squads struggled with cognitive fog, misinterpreting orders or forgetting simple instructions. In reconnaissance units, this confusion proved especially dangerous. Maps were misread, distances misjudged, enemy positions misidentified. The stimulant had sharpened their senses temporarily, only for clarity to collapse when the body could no longer compensate. Commanders who attempted to reduce stimulant use encountered another problem: dependency. Some soldiers grew agitated when denied tablets, complaining of headaches, anxiety, or overwhelming fatigue. A few resorted to asking medics directly or trading supplies with comrades. Officers who tried to regulate distribution often found themselves fighting not exhaustion alone, but a new force, the creeping, psychological reliance that stimulants had cultivated in their men. The dilemma deepened during retreats. When fronts collapsed and divisions were forced into defensive withdrawals, soldiers leaned heavily on stimulants simply to stay awake during nights filled with chaos and artillery fire. Commanders could see that their units functioned on borrowed endurance, the chemical edge, now a fragile substitute for rest, food, or morale. Yet they also knew that without the tablets, their exhausted troops might not survive long enough to reach new defensive lines. Some commanders tried to raise concerns through official channels. They mentioned behavioral instability, post-stimulant crashes, or the risk of operational mistakes. Their messages were met with polite acknowledgement, then buried beneath urgent directives demanding renewed effort. Other officers chose internal solutions, reducing doses quietly, spacing intake more widely, or issuing stimulants only for night operations. But these decisions came with risks. If their unit slowed down, they would answer for it. A few commanders viewed the tablets as a necessary evil. Others saw them as a betrayal chemistry, replacing discipline, desperation, replacing judgment. But even those who privately disliked the stimulants understood the harsh reality. The war Germany had chosen to fight demanded more from its soldiers than sleep, food, and willpower could provide. The stimulants filled the gap, however, imperfectly. And so, day after day, commanders faced the same impossible choice: push their men beyond human limits using chemistry, or risk failing their orders and losing ground. It was a decision made in dugouts, command trucks, and ruined farmhouses, a decision that traded long-term stability for immediate survival. In the end, the commander's dilemma revealed the truth at the heart of the stimulant program. The Wehrmacht was fighting a war that its soldiers as human beings were never built to endure. Stimulants allowed the illusion of limitless endurance, but commanders knew, even if they rarely admitted it aloud, that every tablet handed out brought the army one step closer to a reckoning no drug could prevent. By the time German forces had penetrated deep into occupied territories, stimulants had become more than a tool of endurance. They had begun to shape behavior, alter judgment, and even redefine courage itself. Soldiers, officers, and medics alike observed a new phenomenon, quietly labeled in field notes and diaries as chemical courage, a temporary, drug-induced suppression of fear that allowed men to act in ways their bodies and minds might not otherwise permit. On the battlefield, the effects were visible and immediate. Infantrymen took tablets before night attacks or extended operations, and reports describe a sudden surge in aggression and initiative. Troops advanced into open terrain with fewer hesitations, stormed fortified positions with a mechanical precision, and maintained relentless momentum despite artillery fire and enemy resistance. Commanders marveled at the apparent bravery of their men who marched for days without sleep, laughed through exhaustion, and displayed a level of composure that resembled the stoicism of trained veterans rather than exhausted conscripts. Medical officers, however, recognized the duality of these effects. While stimulants suppressed natural fatigue and fear responses, they also introduced a dangerous volatility. Soldiers, under the influence of chemical courage, became prone to risk-taking beyond tactical necessity. One report from the Eastern Front described an infantry squad crossing a frozen river under artillery fire. Half of the men advanced without hesitation, ignoring cover, while others hesitated or faltered, highlighting how the drug affected perception of danger unevenly. This temporary bravery, although operationally advantageous, sometimes translated into recklessness, leading to unnecessary casualties. The Luftwaffe noted similar effects among pilots. Flight surgeons observed that stimulants heightened alertness and suppressed the natural response to fear. Pilots executed daring maneuvers with an intensity that seemed beyond human tolerance, maintaining focus during long-range sorties and night missions. Yet, after prolonged missions, post-stimulant crashes were severe. Hand tremors, sudden lapses in judgment, and disorientation during critical landings. The chemical edge that enabled them to perform miracles in the air also carried the seeds of catastrophic failure when it faded. Tank crews experienced analogous phenomena. Inside confined panzer interiors, stimulants intensified focus while dulling the emotional response to constant noise, heat, and vibration. Loaders, gunners, and drivers performed extended operations with what officers described as mechanical precision. Yet, medics documented cases of irritability, sudden aggression, and post-mission collapse, emphasizing that courage induced chemically was not courage in the traditional sense, but a temporary override of normal physiological constraints. Commanders faced a subtle but profound challenge. Soldiers' behavior appeared heroic on the surface, but its origin was chemical. Decisions that seemed courageous were, in fact, pharmacologically influenced. Officers began to realize that relying on chemical courage could produce both remarkable feats and unpredictable failures, particularly when stimulants wore off mid-operation. A soldier's heroism in one engagement could become vulnerability in the next if the drug's effect subsided. Despite these warnings, chemical courage became normalized. Reports praising unit effectiveness often highlighted instances of exceptional bravery without noting the drug's role. Military leaders valued results over explanation. The stimulant program reinforced a dangerous illusion that the boundaries of human endurance, fear, and decision-making could be extended indefinitely. On the front lines, soldiers themselves began to conflate chemical enhancement with personal strength. Many believed their stamina, alertness, and daring were products of discipline and courage, not pharmacology. This perception reinforced compliance and loyalty, but also obscured the true costs of stimulant dependence, mental strain, physiological exhaustion, and ethical compromise. By mid-war, chemical courage had become a defining characteristic of German combat operations. It allowed men to achieve feats that would have been impossible naturally, yet it also created a fragile dependence where bravery existed only as long as the tablets worked, and where human judgment was subordinated to chemistry. The stimulant had created a paradox. The soldiers who appeared the strongest, bravest, and most relentless were, in reality, walking a narrow edge between operational advantage and systemic collapse. And in that edge lay the quiet, hidden danger of the Reich's chemical war. By the winter of 1941, the stimulant program that had quietly sustained the Wehrmacht for years was approaching its most critical test. Soldiers on the Eastern Front, moving through the frozen expanses of Russia, were stretched beyond physical, psychological, and chemical limits. Months of continuous operations, extreme weather, inadequate supplies, and unrelenting combat created conditions where the human body could no longer cope without intervention. For many, the stimulants that had been relied upon as a tactical advantage now carried them to a dangerous precipice. The breaking point. Field reports began to accumulate, noting patterns that had been present but less obvious during earlier campaigns. Soldiers who had taken stimulants for extended marches or multi-day engagements began to display erratic behavior more frequently. Reports from medics recorded trembling hands, uncontrolled shivering, and sudden collapses. Units that had previously moved with mechanical precision now faltered in unison, revealing cracks that chemical enhancement could no longer hide. Exhaustion, once masked by stimulants, was now amplified by repeated overdoses and the cumulative stress of continuous combat. The breaking point was not purely physical. Psychological deterioration accelerated under chemical strain. Soldiers displayed heightened irritability, often erupting at minor provocations or conflicts with comrades. Night patrols, previously executed with heightened alertness, became periods of paranoia and fear, where hallucinations of movement in the shadows were reported as fact. Letters later recovered from the front reveal men describing a sense of unreality, where the world seemed distorted, voices sounded strange, and the rhythm of time itself felt unnatural. The stimulants had suppressed natural warning signals, and now the consequences were manifesting as acute mental strain. Commanders faced an agonizing dilemma. On one hand, units faltering without stimulants risked collapse under Soviet counterattacks. On the other, continuing chemical intervention produced unpredictable results. In some cases, soldiers refused to march, arguing they could not continue without tablets, while in others, they advanced with apparent invincibility, ignoring hazards that would normally demand caution. The boundary between courage and recklessness blurred beyond recognition. Commanders were forced to balance immediate operational needs against the invisible threat of chemical-induced breakdowns. Armored divisions reported similar issues. Tank crews, operating in close quarters for days without rest, began to show. Tension-induced mistakes. Loaders misfired shells, drivers misjudged terrain, and gunners missed targets they had previously tracked with ease. Flight surgeons with the Luftwaffe documented pilots entering near catatonic states after prolonged sorties, and navigators admitted to losing track of both time and location during critical reconnaissance missions. Across every branch, the pattern was the same. The stimulants had extended endurance, but they could not prevent eventual collapse. Even the medical corps, once enthusiastic about the program, struggled to respond. Hospitals in the rear lines filled with soldiers suffering post-stimulant fatigue, severe tremors, or mental disorientation. Treatment was limited to rest, nutrition, and temporary care, but the tempo of the campaign allowed little opportunity for recovery. Reports from these hospitals, while classified, noted that many soldiers relapsed into chemical dependency as soon as they were returned to frontline duties. The breaking point also revealed the limits of command. Orders were followed with mechanical precision, Yet the reasoning behind decisions eroded. Soldiers advanced because they had been chemically sustained, not because strategy had dictated it. In essence, stimulants had created a reliance that undermined independent judgment. Military historians later observed that some operational failures were less the result of tactical errors than of chemically induced overconfidence and fatigue crashes. By the winter of 1941, the stimulant program had achieved its paradoxical state. It allowed unprecedented feats of endurance and operational speed while simultaneously sowing the seeds of vulnerability. The Reich soldiers had been pushed to extremes the human body and mind were never designed to sustain. The breaking point was no longer theoretical. It had arrived, and when it did, the consequences would ripple across the army, invisible in the moment, but catastrophic in the months and battles to follow. Amid the chaos of the Eastern Front and the relentless tempo of blitzkrieg operations, the silent observers of the stimulant program were the military doctors themselves. Their instruments were not only stethoscopes and thermometers, but also the meticulous logbooks they maintained, documenting the physiological and psychological effects of chemical enhancement on Germany's soldiers. These records, largely hidden from the chain of command and classified from the public, became a crucial repository of information, a ledger of endurance, breakdown, and the human cost of pharmacologically extended war. Each logbook told the same story in painstaking detail. Infantry medics noted when soldiers received their first doses before night marches, recording times, quantities, and apparent responses. They tracked pulse rates, levels of alertness, and observable behavioral changes. A corporal who had marched 16 hours through mud and snow might be listed as alert, functioning, minor irritability observed. Hours later, as the stimulant wore off, entries would change. Post-dose tremor, verbal confusion, difficulty following commands. Patterns emerged, but they were often buried in the margins, disguised by bureaucratic shorthand. Flight surgeons in the Luftwaffe created similar records for pilots. Each sortie became a page in a larger narrative, documenting hours flown under stimulant influence, reaction times, errors, and physiological indicators. In some cases, pilots reported heightened visual acuity and faster decision-making, but medical notes also captured moments of hallucination, microsleeps, and post-mission collapse. These entries, precise and clinical, reflected an awareness that the stimulant extended performance temporarily but introduced unpredictable human consequences. Tank divisions followed a parallel system. Loaders, gunners, and drivers had their performance logged during extended operations. Hand tremors, misfiring rounds, missed maneuvers, and irritability were all recorded. The logbooks reflected both compliance with military orders and the limitations of human physiology. A commanding officer could review these entries and see a unit moving mechanically across the landscape, but only the medical logs revealed the hidden strain, the subtle collapse of nerves, the overextension of stamina, the chemical scaffolding holding men upright just beyond their natural limits. The logbooks also served a bureaucratic function, providing evidence of compliance with the stimulant directives. Supervisors used them to demonstrate adherence to dosage guidelines and operational protocols, often omitting or softening notes on negative outcomes. Yet within the handwritten pages, the unvarnished truth often persisted. Repeated use caused dependency, behavioral volatility, and cumulative exhaustion. For those who studied the entries closely, a pattern became unmistakable. No chemical intervention could indefinitely substitute for rest, nutrition, and psychological resilience. Some physicians attempted to create separate, confidential records, private journals, that documented side effects more honestly and evaluated the risks of continued use. These personal entries noted the moral and ethical tension inherent in their role. They were simultaneously caretakers and enforcers, doctors and agents of operational necessity. The contrast between official logs and private notes reveals the underlying awareness among medical officers that the program, while tactically advantageous, was pushing soldiers beyond natural human limits. By the end of the first year of sustained stimulant use, these logbooks formed an invisible map of the chemical war. They traced patterns of endurance and collapse, bravery and recklessness, operational success and human cost. In them, one could see the paradox of the program. It created soldiers capable of extraordinary feats, yet dependent on substances that undermined the very foundation of health, judgment, and resilience. In the silence of field hospitals, barracks, and observation posts, these records quietly bore witness. They documented a war waged not only against enemies, but against the limits of the human body and mind, a ledger of achievement shadowed by the costs that would only become fully apparent as the campaigns stretched on. The logbooks were precise, impartial, and clinical, but within their pages lay the true story of endurance purchased at the expense of humanity. As the stimulant program moved from field trials into widespread use, its effects began to appear in one of the most influential forms of military documentation, the battle report. These reports, generated after engagements, were intended to evaluate the performance of units, measure operational success, and provide intelligence for future campaigns. Within them, the chemical edge provided by stimulants quietly left its imprint, often in ways officers and commanders chose not to acknowledge openly. Battle reports from the Eastern Front provide stark testimony. Infantry units that had previously struggled to maintain formation during multi-day marches now reached objectives with surprising speed and cohesion. Officers recorded that troops advanced under fire with minimal hesitation and maintained morale despite harsh conditions. These notes, written in the formal language of military bureaucracy, highlighted extraordinary feats of endurance. Yet, they rarely indicated the underlying factor that made such performance possible: pharmacological intervention. Field medics' annotations, often appended to operational logs, reveal a more nuanced picture. Soldiers, who had marched for 36 hours, reported feeling alert beyond natural expectation, a phenomenon the medics noted as sustained operational capability. At the same time, the same entries recorded sudden post-engagement collapses, trembling limbs, disorientation, and temporary cognitive lapses. The chemical boost allowed men to push further and faster than normal, but only temporarily. Once the stimulants wore off, their bodies often demanded recovery far exceeding normal physiological limits. Armoured units exhibited similar patterns in their reports. Panzer crews, operating in continuous rotations with minimal rest, maintained firing accuracy and maneuvering precision during extended engagements. Tank commanders praised the mechanical efficiency of their crews, describing actions that mirrored pre-planned tactical scenarios with high fidelity. Yet in margins, secondary notes, medics observed agitation, irritability, and in a few cases, minor operational mistakes attributable to overstimulation or post-stimulant crashes. These comments, while factual, were rarely highlighted in the official summaries, which emphasized operational success over human cost. The Luftwaffe's battle reports also reflected the stimulant program's influence. Pilots on extended missions maintained heightened vigilance, spotting enemy aircraft, relaying accurate reconnaissance data, and executing precise maneuvers over long hours. Reports praised their exceptional alertness under prolonged conditions. However, post-mission assessments documented pilots who experienced tremors, confusion, and impaired decision-making once the stimulant effects subsided. Flight surgeons quietly noted that repeated reliance on the tablets increased the risk of long-term dependency. But these cautions were largely absent from the formal documentation used by High Command. Commanders faced a difficult calculus when interpreting these reports. The stimulants produced measurable operational benefits, faster advances, tighter coordination, and enhanced reaction times. At the same time, they introduced unpredictability, psychological strain, and dependency. High-ranking officers often chose to focus exclusively on the former. Any acknowledgement of the latter was minimized or buried in subordinate notes. The language of the reports reflected this bias. Successes were quantified, weaknesses downplayed, and human cost rendered invisible. The cumulative effect of these reports created a feedback loop. High Command, reading battle reports that emphasized stamina and operational efficiency, became increasingly reliant on chemical assistance as part of tactical planning. Units were expected to perform feats that would have been impossible without stimulants, further normalizing the program and obscuring its risks. Soldiers' extraordinary feats became operational benchmarks, and chemical dependence was woven into the Army's standard expectation of performance. By the end of the first year of the Eastern Campaign, battle reports provided a dual narrative. Outwardly, a chronicle of German efficiency and success. Inwardly, a record of soldiers pushed to the limits of endurance, aided by stimulants and quietly paying the cost in fatigue, instability, and human fragility. The battle was won on paper, but the ledger of human strain was written in the margins. By the end of the early campaigns in the East and West, the Wehrmacht had achieved remarkable feats of speed, coordination, and endurance. Soldiers had marched farther, flown longer, and fought harder than any comparable force in Europe. On the surface, the chemical assistance provided by stimulants appeared to validate years of experimentation, planning, and industrial investment. But beneath the statistics and operational reports lay a far more troubling reality: the human cost of artificially extended performance. In the ranks of infantry, medics documented an increasing number of soldiers whose bodies and minds bore the weight of prolonged stimulant use. Tremors in hands and legs became commonplace, particularly after multi-day marches when chemical effects wore off. Sleep, once restorative, was no longer sufficient. Many soldiers experienced extended periods of insomnia, nightmares, and cognitive fog. A soldier who had appeared tireless during a nighttime advance might collapse moments after completing an objective, exhausted to the point of immobility. Field hospitals quietly recorded these collapses, noting that physical and psychological strain often exceeded normal expectations for combat fatigue. Beyond the physical, psychological costs became pronounced. Soldiers described what could only be called chemical-induced euphoria during operations, followed by crushing despair or irritability once the drug effects faded. Field notes and private diaries contain accounts of men snapping at comrades, arguing over minor errors, or becoming dangerously impulsive during operations. Some infantrymen reported a persistent feeling of unreality, as if the world had become a stage, and they were actors sustained only by chemical enhancement. The stimulant, in short, altered not only endurance, but perception itself. Aircrew experienced similar but uniquely dangerous consequences. Pilots who relied on stimulants to maintain concentration during extended missions sometimes experienced delayed reactions or impaired judgment when landing or engaging with enemy aircraft. Flight surgeons documented cases of post-mission disorientation so severe that some airmen required immediate medical attention. In rare but devastating instances, chemical fatigue contributed directly to accidents or loss of aircraft. The very substance that allowed extraordinary feats in the air simultaneously undermined the men tasked with executing them. Armoured crews were equally affected. The confined space of a panzer amplified stressors, heat, vibration, noise, while stimulants extended alertness beyond normal limits. Once the effects wore off, crews faced sudden physical collapse and heightened irritability. Errors, misfires, and minor accidents increased, quietly undermining operational effectiveness, even as the chemical program gave the illusion of heightened performance. Commanders, accustomed to viewing results rather than individual conditions, often overlooked these cumulative effects. Successes were attributed to training, discipline, and morale. Failures were sometimes blamed on minor tactical errors. The logbooks and field reports, which had quietly recorded the true costs, were relegated to secondary analysis, never forming the basis for policy changes. The human toll, psychological, physiological, and ethical, remained largely invisible. The long-term effects of stimulant use were equally severe. Soldiers developed dependency, requiring tablets to sustain normal operational functions. Withdrawal manifested as weakness, irritability, and cognitive impairment. Even after the cessation of active campaigns, many veterans struggled with lingering tremors, chronic insomnia, and emotional instability, silent reminders of what had been asked of their bodies and minds. In the end, the human cost of chemical enhancement revealed the paradox of the program. Stimulants had extended performance, enabling unprecedented tactical feats, but they had also stretched the limits of human endurance beyond safe boundaries. Soldiers who appeared invincible were, in reality, fragile, their bodies and minds borrowed against a capacity nature never intended to exceed. The Reich had achieved operational brilliance through chemistry, but it had done so on the hidden ledger of human fragility, a record of endurance bought and paid for in sweat, trembling, and the quiet suffering of men whose limits had been erased, only to return with devastating force. As the war stretched into its second year, a new, insidious pattern began to emerge across the Wehrmacht: chemical dependency. Soldiers who had initially taken stimulants sporadically during night marches, extended reconnaissance, or long-distance armoured manoeuvres now increasingly relied on them as a matter of routine. The tablets that were once seen as operational aids became, in many cases, a psychological and physiological necessity. Dependency had quietly become a structural element of the army, hidden behind the facade of discipline and performance. Field medics first noted the phenomenon in scattered cases. A young infantryman refused to take a position in a defensive line without receiving his morning stimulant. A tank crew member grew irritable and distracted when a shipment of tablets was delayed during a rapid advance. Flight surgeons documented pilots insisting on additional doses for even routine sorties, reporting anxiety, jitteriness, or fatigue if denied. What had started as a tactical tool now governed behavior, shaping the daily functioning of units across multiple branches. Dependency took multiple forms. Physically, soldiers developed a tolerance. The same dose produced less effect over time, prompting medics to administer larger quantities to achieve the desired alertness. Psychologically, the expectation of chemical enhancement created a mental reliance. Soldiers internalized the belief that they could not perform at the necessary level without the stimulant, eroding natural confidence and resilience. Reports from the field indicated an alarming number of men experiencing anxiety, restlessness, or agitation during the periods between doses, demonstrating the program's growing grip on their behavior. Commanders were often aware of these dependencies but struggled to respond. Reducing doses risked impairing operational performance, potentially slowing advances or compromising missions. Complaints were frequently ignored or reclassified as combat stress or disciplinary issues, ensuring that the broader pattern remained invisible to higher command. In some cases, officers actively encouraged continued use, viewing dependency as a necessary trade-off for maintaining the relentless tempo demanded by blitzkrieg operations. The consequences were both immediate and cumulative. Soldiers dependent on stimulants were prone to sudden crashes when effects wore off, creating vulnerabilities at critical moments. In the East, where marches and attacks were continuous, these crashes sometimes coincided with enemy action, resulting in disorganization, operational errors, or unnecessary casualties. In the Luftwaffe, pilots suffered lapses in attention or misjudged maneuvers, contributing to losses that might have been avoided under natural, rested conditions. Armored crews displayed heightened irritability, mistakes in gunnery, and occasional miscommunication during prolonged operations. The stimulant, once a tool of enhancement, became a double-edged sword, sustaining performance while simultaneously increasing risk. Dependency also introduced ethical dilemmas among the medical corps. Medics and physicians observed patterns of overuse, mood disorders, and early signs of addiction, but their capacity to intervene was limited by both hierarchy and ideology. Reporting the problem risked professional censure, reducing doses risked operational failure, Many medical officers maintained private records of these cases, documenting the growing prevalence of reliance, even as official directives continued to promote distribution. By mid-war, the chemical dependency among soldiers had become systemic. It influenced training, performance, and morale. Entire units were now structured around stimulant-assisted schedules and the rhythm of operations, from night marches to aerial patrols, was governed not only by command but by the predictable rise and fall of chemical stimulation in the bloodstream. Dependency was no longer an anomaly. It had become part of the army itself, a hidden force shaping strategy, behavior, and survival in ways that few outside the medical corps fully understood. The Wehrmacht had built a force capable of extraordinary endurance, but in doing so, it had bound its soldiers to a fragile chemical lifeline from which there was no easy escape. As stimulant use became pervasive across the Wehrmacht, the responsibility for oversight increasingly fell to the officers' men whose authority was defined by hierarchy, discipline, and the rigid structure of military command. Their role was not merely to lead in battle. It extended to controlling the distribution, monitoring the effects, and enforcing compliance among troops whose behavior was increasingly influenced by chemicals. Yet oversight in this environment was complicated, inconsistent, and, at times, dangerously inadequate. Officers received formal instructions from the medical corps outlining when and how stimulants were to be issued. Infantry platoons were told to administer them before night marches, during prolonged operations, or prior to engagements that demanded extended attention. Tank crews and artillery units followed similar protocols, while Air Force pilots were advised to take doses before long sorties. Commanders were expected to ensure that soldiers received their tablets according to schedule and that any adverse effects were reported. On paper, the system seemed precise, a controlled integration of chemical assistance into military operations. In practice, oversight was uneven. Frontline conditions were chaotic, supply lines were often disrupted, and officers frequently found themselves improvising distribution schedules based on availability rather than strict guidelines. Soldiers became adept at acquiring additional doses, sharing among themselves, or hoarding tablets for particularly grueling operations. Officers, faced with urgent operational demands, often prioritized mission success over strict adherence to chemical protocols. In these moments, oversight became secondary to survival and effectiveness. The human element further complicated enforcement. Many officers recognized the stimulant's dual nature. It enhanced alertness and performance, yet it also increased agitation, risk-taking, and dependency. Some attempted to regulate use carefully, spacing doses and monitoring for signs of collapse or agitation. Others, under pressure to meet ambitious operational goals, issued tablets liberally, overlooking side effects in favor of immediate results. These decisions were rarely questioned, as the chain of command emphasized obedience and outcomes over cautious medical judgment. Reports from medics illustrate the practical consequences of these oversight challenges. Soldiers sometimes displayed post-stimulant crashes during critical moments, with tremors, disorientation, or sudden fatigue. Field reports described gun crews misfiring, infantrymen stumbling during night operations, and pilots experiencing brief lapses in coordination. Officers were expected to manage these situations in real time, making judgment calls that balanced chemical influence, operational needs, and the safety of their men. Many relied on experience and intuition, but the unpredictability of stimulant effects made even seasoned officers vulnerable to errors in decision-making. The bureaucratic dimension of oversight added further strain. Documentation requirements, logs of doses administered, behavioral observations, and medical annotations created a paper trail that officers were responsible for maintaining. Yet the sheer volume of troops and operations often rendered these records incomplete or inaccurate. Many reports softened or omitted side effects to protect careers or avoid scrutiny. In some cases, officers altered terminology, labeling chemical-induced agitation as combat stress or post-dose fatigue as operational strain, ensuring that negative observations never reached higher echelons. Ethical tensions persisted quietly. Officers were aware that stimulants were pushing soldiers beyond natural limits, yet they were pressured to prioritize performance and obedience. The program required them to mediate between human vulnerability and operational necessity, a balance that became increasingly fragile as campaigns stretched across vast distances and prolonged periods. By mid-war, it was clear that oversight could not fully mitigate the risks. Chemical support amplified endurance and tactical precision, but introduced unpredictability into human behavior. Officers became the crucial interface between command objectives and the physiological limits of their men, tasked with maintaining operational efficiency while managing the consequences of artificial enhancement. In this role, officers bore the burden of responsibility, a constant negotiation between authority, morality, and survival. The stimulants extended human capability, but the men entrusted to oversee their use faced a relentless challenge: to enforce control over forces whose bodies were no longer entirely their own. By the time the Wehrmacht was fully engaged on multiple fronts, the psychological impact of stimulant use had begun to manifest in subtle but profound ways. The drugs that had been intended to extend endurance and sharpen focus did not simply enhance human performance. They altered perception, suppressed natural responses to fear, and introduced mental strains that commanders, medics, and soldiers themselves were only beginning to recognize. Across the infantry, armored divisions, and air force, the mental costs of chemical enhancement became an invisible battlefield, one fought inside the minds of men who were often unaware of what was happening to them. Soldiers' accounts describe a peculiar duality: moments of hyper-alertness and confidence, followed by sudden crashes into fatigue and emotional instability. Field diaries from the Eastern Front note how soldiers marched for hours with a clarity that seemed unnatural, only to experience tremors, disorientation, or overwhelming anxiety when the stimulants wore off. Some described the sensation as being awake but not present, as if their bodies continued while their consciousness lagged behind. The chemical manipulation of fear and fatigue had created temporary resilience, but the human psyche paid for it in cumulative stress. The effects were not evenly distributed. Younger, less experienced soldiers often adapted poorly to chemical enhancement. They became jittery, hypervigilant, or prone to impulsive behavior under duress. In some cases, medics recorded instances of soldiers shouting orders without authority, refusing commands, or reacting violently to minor provocations. The stimulants heightened aggression and reduced natural caution, which, while advantageous in limited tactical scenarios, sometimes undermined unit cohesion and operational control. Armored crews faced compounded psychological strain, trapped in confined, vibrating metal boxes, subjected to heat, noise, and the constant threat of artillery. Stimulants enabled crews to operate longer than physiologically reasonable. But as hours passed, stress amplified. Loaders misfired shells, gunners overcompensated in aiming, and drivers misjudged terrain. Even brief lapses in attention became amplified under chemical stimulation, and the isolation inside tanks intensified the mental pressure. Medics documented subtle personality shifts, irritability, paranoia, and sudden emotional outbursts that often dissipated once the stimulant wore off, leaving exhaustion and disorientation in their wake. Pilots experienced an even more acute form of psychological pressure. In long sorties over hostile airspace, stimulants suppressed natural fatigue and fear, allowing them to maintain focus for hours beyond the body's normal limits. Yet the drug also heightened sensory perception to unnatural levels. Every engine hum, every wind gust, and every movement on the horizon was intensified. Pilots reported mental fatigue not from sleep deprivation alone, but from the relentless bombardment of sharpened stimuli. Decisions were made faster, sometimes recklessly, and lapses in judgment occurred when chemical effects waned. The psychological strain extended beyond individual soldiers to units as a whole. Officers observed that entire platoons could function as if mechanically coordinated during periods of stimulant use, yet the same units collapsed in coherence during chemical crashes. The temporary suppression of fatigue and fear created a fragile equilibrium, one that could snap unpredictably under pressure. Field psychiatrists noted early warning signs of long-term consequences: anxiety disorders, insomnia, irritability, and early signs of chemical dependence. Yet these were often underreported or downplayed, subordinated to operational priorities. The immediate tactical advantages overshadowed the subtle erosion of mental resilience. By mid-war, psychological strain had become an unspoken, pervasive factor in the Wehrmacht. Chemical endurance had created an army capable of extraordinary physical feats, but it had done so by altering the natural rhythm of human cognition and emotion. Soldiers moved farther, fought harder, and reacted faster, but at the cost of mental stability, awareness, and long-term well-being. The stimulant had extended physical limits, but it had also stretched the mind, quietly bending perception, suppressing fear, and embedding a fragile, dangerous dependence within the very fabric of the fighting force. By the third year of the war, the stimulant program had grown from an experimental measure into a fully institutionalized element of the Wehrmacht's operational logistics. What began as occasional, targeted dosing during night marches or extended operations had evolved into a routine, system-wide practice, creating not only chemical dependency in soldiers, but also a new layer of administrative complexity. Ensuring that millions of men across multiple theaters received a steady supply of stimulants required planning, coordination, and a bureaucracy dedicated to maintaining both availability and control. The logistics began at the factories, which operated at near continuous capacity. Tablets were produced in massive quantities, packaged for military shipment, and labeled with unit-specific identifiers to track distribution. Supply officers coordinated with railway networks, military, depots, and quartermasters to integrate stimulants into existing supply chains alongside ammunition, rations, and fuel. The chemical became part of a larger military ecosystem, vital, standardized, and inseparable from the movement of troops across the front. Once dispatched from factories, the WWII stimulants moved along predictable but carefully controlled channels. Rail transport carried bulk shipments to regional depots near the front lines, where medical officers received them for redistribution. Trucks and convoy units then delivered the tablets directly to field medics and unit stores. In some cases, stimulants were included in daily ration kits or packaged in small tins for officer oversight. The system was meticulously planned to prevent shortages, ensuring that operational tempo would not be interrupted by chemical unavailability. However, the rapid expansion of the program created unforeseen complications. Dependence among soldiers meant that demand was no longer predictable. Medics reported that troops often requested extra doses during extended operations or between official issue times. Some soldiers hoarded tablets, sharing or trading them in ways that disrupted planned distribution. Officers, aware of the problem but unwilling to risk decreased operational effectiveness, often allowed flexible dispensing. This improvisation, while effective in maintaining immediate performance, created a feedback loop in which soldiers' chemical reliance intensified, increasing both logistical complexity and risk. The strain on supply chains extended beyond distribution. Stimulants required secure storage, precise record-keeping, and monitoring of expiration dates and quality. Rear depots needed personnel capable of handling chemical stocks, verifying purity, and maintaining confidentiality. Any disruption, a damaged rail line, delayed shipment, or clerical error could jeopardize operational continuity. Commanders learned quickly that, unlike food or ammunition, Stimulants could not be rationed without affecting both physical performance and morale. A shortage at a critical moment could result in a cascade of fatigue, agitation, and operational failures. Moreover, the system reinforced dependency institutionally. Soldiers understood that their endurance, alertness, and survival increasingly relied on the chemical supply. Units adapted, operationally around stimulant availability. Night marches were planned assuming chemical support, long-range reconnaissance accounted for dosage schedules, and continuous engagements were scheduled with awareness of when effects would fade. Dependency became a structural feature, as embedded as supply lines, communication networks, or vehicle maintenance schedules. Field medics and officers recognized the risks, but faced no practical alternatives. To reduce stimulant use meant slowing operations, risking casualties, or failing orders, unacceptable under the strategic doctrine of blitzkrieg and total war. Thus, chemical dependency became an invisible but essential component of military logistics, shaping planning, tactics, and the very tempo of operations. By mid-war, the stimulant network was a vast, silent infrastructure. It moved across railways, through convoys, into field hospitals, and finally into the hands of soldiers whose performance depended on it. What had begun as a tactical experiment had evolved into a systemic, operational necessity, a network designed to sustain endurance, enforce compliance, and perpetuate dependence. The Wehrmacht could march, fight, and strike faster than any force before it, but the machinery sustaining this performance depended not only on bullets and fuel, but on the invisible chains of chemical reliance. At the front line of stimulant administration, the field medics occupied a precarious position. These men and women were charged with the health and welfare of soldiers, yet their role had evolved into something far more complex. They were both caregivers and distributors of chemicals that pushed the human body and mind beyond its natural limits. Each march, each sortie, each assault carried the implicit responsibility of balancing operational efficiency with the well-being of men who were chemically sustained, psychologically strained, and often unaware of the full risks involved. Field medics were trained to observe, record, and report. They monitored pulse, respiration, and alertness, noting signs of tremors, dehydration, or overstimulation. In infantry units, medics walked alongside columns, checking for men who lagged or faltered under the combined pressures of march and chemical augmentation. Tanks were no different. Medics inspected armored crews between engagements, logging errors, agitation, or physical strain that emerged after prolonged stimulant use. The observational burden was immense, compounded by the stress of their own exposure to combat. Yet the medics' observations were seldom acted upon in a meaningful way. Commanders were primarily concerned with speed, coordination, and mission completion. Soldiers who displayed signs of chemical fatigue or emotional volatility were often ordered to continue or to receive additional doses rather than rest. Medics became enforcers of chemical compliance, responsible for issuing stimulants at the proper intervals, documenting their use, and monitoring units for signs of collapse, all while knowing that many adverse effects would not be officially acknowledged or mitigated. The psychological toll on medics was significant. They witnessed men suffering from overstimulation, crashes, and dependency, while simultaneously being pressured to maintain operational tempo. Field notes describe soldiers shaking uncontrollably after extended use, displaying irritability, hallucinations, or disorientation. Medics were forced to triage these symptoms, often treating immediate physical collapse while leaving psychological strain unaddressed. They carried the knowledge of the hidden human cost, a responsibility intensified by the secrecy surrounding the stimulant program. Supply and dosage decisions added another layer of complexity. Medics were expected to calculate and distribute tablets according to operational demands, environmental conditions, and individual tolerance. The margin for error was minimal. Too little, and soldiers risked collapse or diminished performance too much, and the stimulant could induce severe agitation, cardiac strain, or acute psychological effects. These judgments were often made under extreme stress during marches, under artillery fire, or amidst the chaos of advancing and retreating fronts. Medics also faced ethical conflicts. Their oath to protect soldiers clashed with orders to maintain chemical dependence for operational effectiveness. Some attempted to moderate doses, spacing administration to reduce the risk of crashes or behavioral volatility. Others documented adverse effects in private journals, creating a hidden record that acknowledged the costs overlooked by official reports. Yet such efforts were limited. The tempo of combat and the priorities of command left little room for medical discretion. The result was a dual reality. Soldiers were chemically enhanced, temporarily sharper and faster, while medics navigated an invisible battlefield of human fragility, ethical compromise, and psychological strain. The stimulant program transformed their role from simple caregivers into essential operators in a system designed to maximize endurance and suppress natural limits. By the midpoint of the war, field medics were on the edge, sustaining chemical performance in men whose dependence they both facilitated and feared. Their work ensured operational effectiveness, but it also recorded, in quiet observation, the growing human cost of a war waged on biology as much as strategy. In the shadows of the front, medics bore witness to the hidden consequences of chemical endurance, the trembling hands, the frazzled nerves, and the slow erosion of humanity that no report would ever fully acknowledge. While stimulants sustained the relentless tempo of ground operations, the Luftwaffe provided a laboratory for understanding their profound impact on human psychology and endurance in extreme conditions. Pilots, navigators, and gunners wrote diaries, reports, and personal notes that inadvertently documented the complex interplay of chemical enhancement, stress, and operational necessity. These records, though private at the time, reveal the hidden toll of stimulant use on aircrews, who were expected to perform miracles at altitudes and speeds beyond natural human limits. The diaries open with accounts of hyper-alertness. Pilots describe a clarity that allowed them to navigate for hours through clouds, track enemy aircraft across vast distances, and coordinate with fellow airmen in maneuvers that would normally demand a fully rested mind. Navigators noted the enhanced focus that enabled precise map reading and target acquisition during extended reconnaissance flights. Gunners, seated for hours in vibrating turrets, reported heightened reaction times, able to track multiple fast-moving targets simultaneously without the lapses of fatigue that typically plagued long missions. In these passages, the stimulant is described almost clinically, a neutral tool, enhancing perception, alertness, and reaction. Yet beneath these accounts lies a consistent pattern of strain. Many pilots reported episodes of disorientation, dizziness, or sensory overload during flights, lasting more than 12 hours. The hyper-alertness induced by stimulants amplified the perception of engine hum, wind noise, and the rush of air past the cockpit. Small, innocuous details became distracting stimuli, a flicker on the instrument panel, a distant shadow on the horizon that could momentarily disrupt judgment. While the chemical edge allowed the men to remain awake and focused, it also introduced new forms of cognitive fatigue, hidden beneath the outward appearance of competence. Several diaries detail the emotional effects. Pilots recorded feelings of detachment, the sense that they were observers rather than participants, floating above the world while their bodies operated at peak capacity. Some described an artificial bravery, a suppression of natural fear that allowed them to execute dangerous maneuvers, dive into flak, or chase enemy aircraft with a level of audacity they would have never attempted otherwise. Yet this bravery was chemically induced, temporary, and often accompanied by bursts of irritability or heightened aggression once the stimulant's effect began to wane. Post-mission crashes into exhaustion were recurrent themes. Pilots described collapsing into bunks with hands still trembling, unable to sleep, or experiencing nightmares fueled by sensory overstimulation during flight. Some diary entries reveal self-awareness of dependency, men acknowledging that they could no longer remain effective without a tablet before takeoff. Others recorded anxiety during periods when stimulants were unavailable, noting heightened heart rates, restlessness, and mental agitation. The diaries reveal that chemical enhancement created a fragile reliance, binding aircrews to a regimen that demanded precision and control even in the absence of physical necessity. The documentation also highlights systemic consequences. Flight surgeons occasionally noted these patterns in formal reports, connecting stimulant use to lapses in judgment, impulsive maneuvers, and occasional accidents. However, operational imperatives often overshadowed these warnings. Command prioritized mission success over psychological well-being, tacitly accepting the hidden human cost of chemically sustained performance. In the end, the aircrew diaries provide an unvarnished window into the effects of stimulant use in extreme operational contexts. They record not just endurance and precision, but the tension between temporary enhancement and human vulnerability, revealing the delicate balance between operational gain and the erosion of mental resilience. Above the clouds, the stimulants worked. Below the surface, in diaries, scrawled under dim lights, the cost was quietly inscribed. Dependency, cognitive strain, and the hidden fragility of men elevated beyond natural limits. Night operations became the proving ground for both the Wehrmacht's strategic ambitions and the stimulant program's influence on human performance. Darkness brought its own hazards: disorientation, fatigue, and heightened psychological strain. Soldiers were expected to navigate unseen terrain, maintain precise coordination, and execute complex maneuvers under the constant threat of enemy fire. In these conditions, stimulants were deployed extensively, allowing men to operate beyond natural limits while masking the accumulating costs. Infantry units, often marching through forests, swamps, and urban rubble, relied on stimulants to sustain alertness. Commanders scheduled night advances with the expectation that chemical assistance would offset natural fatigue. Medics distributed tablets prior to departure, and soldiers, conditioned by repeated use, often requested additional doses if operations extended beyond the planned hours. Logs from the front indicate that the initial phases of these night operations were marked by exceptional cohesion and surprising speed, with units covering terrain that would have previously taken days in a single night. The chemical edge, however, introduced its own complexities. Soldiers reported heightened awareness that sometimes bordered on sensory overload. Shadows became threats, sounds exaggerated into imagined movement, and faint noises prompted sudden reactions. While these heightened perceptions occasionally enhanced combat effectiveness, allowing units to detect ambushes or avoid mines, they also produced anxiety, startle responses, and occasional misfires. Medics noted that prolonged exposure to stimulant-enhanced alertness during darkness increased the risk of disorientation and mistakes. Yet, operational imperatives often overrode these concerns. Armored units faced similar challenges. Tanks moving through poorly mapped terrain relied on drivers and commanders to maintain coordination under darkness. Stimulants allowed crews to stay awake and focused for hours, reducing errors caused by exhaustion. But logs reveal that once the stimulants wore off, crews experienced sudden crashes in attention, leading to navigation errors, miscommunication, and mechanical accidents. The drug provided temporary clarity, yet created a dependency on chemical intervention to sustain it through extended night maneuvers. The Luftwaffe also integrated stimulants into nocturnal sorties. Pilots tasked with reconnaissance or night bombing relied on chemical enhancement to combat both fatigue and the psychological strain of darkness. Flight diaries reveal that stimulant use improved reaction, times, and vigilance, enabling pilots to navigate in low visibility and respond rapidly to threats. However, the heightened state also intensified stress responses. making errors more likely if the stimulant's effect diminished mid-flight. Some pilots reported feelings of agitation, hallucinations, or disorientation upon returning to base, describing the night as simultaneously sharper and more oppressive. Night operations underscored a broader paradox. Stimulants allowed soldiers to exceed their natural limits, yet they simultaneously amplified the risks inherent in operating under extreme conditions. Fatigue, fear, and disorientation were suppressed, not eliminated. The chemical edge created a brittle endurance functional and formidable in the short term, but prone to sudden collapse once the stimulant's effect diminished. Commanders, aware of these dynamics, adapted tactics to account for chemical reliance. Night marches were timed to coincide with the expected peak of stimulant activity. Reserves and relief units were positioned to intervene during anticipated crashes. Yet even with careful planning, the human cost remained invisible to official reports, relegated to private logbooks and field diaries. Soldiers bore the weight of sustained vigilance in silence, while the army celebrated operational success. The darkness of night revealed both the promise and peril of chemical enhancement. Stimulants allowed soldiers to march longer, fly further, and maintain focus when human endurance naturally faltered. But in doing so, they also exposed the fragility of the body and mind, creating dependence and vulnerability that would shadow the Wehrmacht long after the operations ended. In the quiet between missions, soldiers rested, but their bodies and nerves remained under strain, a living testament to the precarious balance between operational advantage and human limitation. By 1942, the initial momentum of Germany's campaigns had begun to waver, particularly on the Eastern Front. The vast distances, brutal weather, and relentless Soviet resistance strained supply lines, morale, and, crucially, the very soldiers who had been chemically enhanced to sustain impossible operational tempos. The stimulant program, once hailed as a means to extend endurance and sharpen judgment, now became a fragile crutch amid retreats, forced withdrawals, and collapsing fronts. As units were ordered to fall back under pressure, the human cost of chemical reliance became painfully evident. Soldiers who had marched for days or flown extended sorties under stimulant influence began to suffer acute physical and psychological crashes. Reports from field medics describe men collapsing mid-march, unable to rise, limbs trembling violently, and minds fogged by exhaustion. Infantrymen who had advanced with mechanical precision now struggled to coordinate, misinterpreted commands, and sometimes abandoned positions entirely, creating dangerous gaps in retreating lines. Armored divisions, previously operating with the seeming invincibility of chemical-enhanced alertness, faced similar breakdowns. Crews who had once maintained tight formations during long pushes now mismanaged navigation through difficult terrain, collided with obstacles, or misfired under stress. Tanks, once symbols of relentless momentum, were immobilized not by enemy fire alone, but by the human limitations of chemically strained operators. Medics and mechanics documented incidents of crew tremors, confusion, and disorientation, revealing the hidden dependency that had grown under the stimulant program. The Luftwaffe suffered in parallel, pilots returning from extended sorties during withdrawal operations frequently reported sudden lapses in concentration, vertigo, or severe tremors. Flight surgeons noted cases of overconfidence during initial engagement, followed by catastrophic inattention once stimulant effects waned. Reconnaissance missions became particularly perilous. Pilots, chemically sustained to maintain focus over long distances, sometimes misidentified enemy positions or missed critical signs of ambush, contributing to operational setbacks. Diaries recovered later reveal pilots' own awareness that their perceived stamina was chemically induced, a fragile and temporary state. Commanders faced an almost impossible dilemma. Units faltering due to post-stimulant collapse risked encirclement or destruction, yet reducing stimulant use threatened even greater immediate weakness. Orders demanded movement and engagement, while medics and officers observed the human consequences of sustained chemical stress. Many field reports quietly emphasized loss of cohesion and delayed reactions, yet operational directives left no space for rest or rehabilitation. The very system that had once amplified human capability now constrained it. The retreats revealed a paradox. Stimulants had extended endurance, enabling feats previously impossible for human soldiers, yet that same chemical extension had concealed vulnerability until it could no longer be ignored. Units moved faster, fought longer, and appeared stronger, but the sudden collapses in mid-march, mid-sortie, or mid-assault exposed the limits of pharmacologically extended performance. Dependency, psychological strain, and cumulative fatigue converged with operational stress, producing failures that were both predictable and catastrophic. Field diaries capture the human dimension of these collapses. Soldiers wrote of hands shaking uncontrollably, vision blurring, and an overwhelming sense of fatigue that no stimulant could mask. Others described panic, irritability, and fear that surged once the temporary chemical edge faded. Medics recounted moments when entire squads appeared functional only to collapse within minutes of reaching a temporary bivouac. The retreating army, once heralded for its speed and precision, became a patchwork of exhausted men, held together tenuously by chemicals, discipline, and sheer necessity. In these withdrawals, the hidden costs of stimulant dependence became unavoidable. Operational advantage could no longer mask the fragility of soldiers' bodies and minds. The retreats and collapses marked a turning point, exposing the human limits that chemistry had only temporarily concealed. The war had pushed men beyond natural endurance, and now the consequences were undeniable. By the middle years of the war, the stimulant program had evolved from a controlled experiment into a fully institutionalized component of the Wehrmacht's operational doctrine. What had begun as a tactical enhancement now carried profound ethical implications, raising questions that few officers, medics, or policymakers were willing or able to confront. The ethical collapse of the program was not a single event, but a gradual erosion of professional and moral boundaries, accelerated by the pressures of combat, hierarchy, and ideology. Medical officers, trained to preserve life and alleviate suffering, were placed in a dual role. They were both caretakers and enforcers of chemical endurance. Daily, they observed the effects of stimulant administration on soldiers' bodies and minds. Tremors, insomnia, agitation, and aggressive behavior were recorded meticulously in logbooks, yet interventions were limited to rest or emergency care. Commanders expected continuous operational output. The ethical responsibility to prevent harm was subordinated to mission completion. Over time, the professional obligation of the doctor became inseparable from the state's demand for performance, eroding the very foundation of medical ethics. Field medics, too, experienced the collapse firsthand. Tasked with distributing stimulants, they became facilitators of chemical dependence. The act of ensuring operational continuity often required them to administer substances despite witnessing adverse effects. A soldier complaining of anxiety, hallucinations, or extreme fatigue could not be excused from duty without jeopardizing unit performance. Medics faced a moral contradiction: sustain the soldier's life and effectiveness chemically, or allow natural limits to dictate operational failure. The choice was rarely presented as optional, and in this tension, ethical judgment was quietly compromised. Commanders, conditioned by military necessity and ideological indoctrination, largely ignored the human consequences of stimulant use. Battle reports praised the extended endurance, rapid advances, and heightened alertness of chemically supported units, rarely noting post-dose crashes or psychological strain. The rhetoric of victory and operational success overshadowed moral considerations. Officers tacitly accepted that stimulants enhanced performance at the expense of long-term physical and mental health. prioritizing immediate effectiveness over the well-being of the men under their command. The program also undermined consent. Soldiers often received stimulants without a full understanding of the potential consequences. Tablets were presented as tools for maintaining alertness, framed as necessary for survival and success. Few understood the risks of dependency, psychological destabilization, or physiological breakdown. In this context, the ethical principle of informed consent was systematically eroded. Men were effectively conscripted into chemical endurance, their autonomy subordinated to operational necessity and state authority. The cumulative effect was a profound ethical collapse across the Wehrmacht. Doctors compromised their Hippocratic obligations, medics facilitated chemical dependency, and commanders prioritized operational success above human welfare. At every level, the moral framework that should have governed the treatment of soldiers had been replaced by a utilitarian calculus: effectiveness over humanity, efficiency over ethics. The consequences were both immediate and enduring. Soldiers were sustained artificially, but at the cost of autonomy, psychological stability, and trust in the very institutions meant to protect them. By mid-war, the ethical compromise was complete. The stimulant program had transformed the Wehrmacht's approach to endurance, performance, and human limits. What had begun as a medical and tactical innovation now reflected the dangerous convergence of ideology, necessity, and moral compromise. The chemical edge extended capability, but it did so by quietly dismantling the ethical framework that should have safeguarded the men sustaining it. As the war progressed and eventually drew toward its catastrophic conclusion, the stimulant program left a legacy that extended far beyond immediate operational effectiveness. The chemical augmentation that had initially promised sharper focus, longer endurance, and unprecedented tactical mobility had, by its culmination, redefined the boundaries of human performance and exposed the Wehrmacht, its soldiers, and its medical corps to consequences that would reverberate long after the conflict ended. From a military perspective, the program had succeeded in the short term. Soldiers, pilots, and armored crews moved farther, acted faster, and maintained operational intensity beyond what human endurance alone would allow. Blitzkrieg tactics, rapid armored thrusts, coordinated air support, and relentless infantry advances were supported by a workforce chemically sustained to function at a level approaching the impossible. Field reports, battle diaries, and post-mission analyses all reflected a clear pattern. Stimulant-enhanced units achieved objectives with a consistency and speed that would have been unattainable naturally. Yet these victories masked a far deeper cost. Physiological consequences accumulated in soldiers' bodies. Tremors, cardiovascular strain, chronic fatigue, and sleep disorders became increasingly common among veterans. Repeated reliance on stimulants altered natural recovery cycles, leaving men susceptible to both physical and psychological breakdown. Medics and doctors had long recorded these patterns in field journals, but operational priorities and ideological imperatives had suppressed recognition and intervention. The very tool that extended performance simultaneously eroded the foundation of human resilience. Psychological and emotional consequences were equally profound. Soldiers who had relied on chemical enhancement often reported lingering anxiety, hypervigilance, and emotional instability even after the cessation of combat operations. Diaries and personal letters reveal men grappling with distorted memories of battle, oscillating between overconfidence during stimulant use and disorientation, panic or despair when the effects faded. Dependency, both psychological and physiological, became a pervasive reality, reshaping the post-war lives of thousands who had survived the front lines. The ethical dimension of the program's legacy cannot be understated. The deliberate distribution of stimulants without informed consent, the suppression of side effects in official reports, and the tacit encouragement of chemical reliance reflected a systemic moral compromise. Medical officers, medics, and commanders were all complicit in a framework that prioritized operational efficiency over the well-being of individuals. Long after the war, historians and military analysts would scrutinize this collapse of ethical oversight as a stark illustration of the dangers inherent in subordinating human welfare to strategic objectives. Industrially, the program demonstrated the remarkable capacity of the Reich's wartime economy to integrate chemical production into military supply chains. Factories, transport networks, and field depots were mobilized to support a pharmacological campaign parallel to traditional logistics. Yet this efficiency came at the expense of soldiers' bodies, transforming them into chemically dependent instruments optimized for temporary performance rather than sustainable endurance. In retrospect, the stimulant program serves as both a tactical case study and a cautionary tale. It shows how human performance can be extended artificially under extreme conditions and highlights the operational benefits of such enhancement. Simultaneously, it exposes the fragile ethical, physiological, and psychological underpinnings that make such programs inherently dangerous. Its legacy is therefore dual, a record of unprecedented endurance and a testament to the limits of humanity when chemistry supplants natural resilience. The war would eventually end, fronts would collapse, and the machines of combat would fall silent. Yet, the echoes of the stimulant program, its achievements, failures, and human costs endured in the lives of soldiers, the judgments of historians, and the moral calculus of future military planners. The chemical edge had shaped the war, but it had also left an indelible imprint on those who carried it, a legacy of endurance, fragility, and the perilous intersection of human limits and artificial enhancement.